Welcome everyone to the Lincoln City Council meeting of March 15th, 2021. It's in accordance with the LB 898. Please be advised that there's a copy of the Open Meeting Act posted in the back of the chamber at the northwest door. Let's all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, the order of business for the City Council will be as follows. The clerk will call the items listed on the agenda under public hearing. Anyone wishing to speak on an item must first register and sign in at the table, either located in the lobby or up here. Anyone wishing to speak on an item should come forward after the clerk reads that item. The applicant then may make one short rebuttal after all the speakers. Each speaker should begin by stating their name, address, and whether they are speaking in favor or opposition. Testimony will be limited to 5 minutes per speaker. Clerk will call the names of those registered to speak, and if you've signed in, and we'll call them in order as they signed in for today's meeting. After all the public hearings, the council will vote on the resolutions and items listed under, and the items that are listed under third reading. And then on the second and last Monday of the month, immediately prior to adjournment, anyone may speak on any issue not on the agenda for that date, nor planned for a future agenda. Will the clerk please call the first item of business?
If you wish to appear in person on an item on the agenda, you may come to the County City Building, 555 South 10th Street. Limited seating is available in the council chambers. Testifiers are asked to wait in the Bill Luxford studio or the hallway until your item is called. Then you can enter the council chambers and come to the podium. After you are finished speaking, you can exit the chambers through the door to your immediate left. First up on the agenda is public hearing consent agenda. Items 1A through 2C.
Councilperson Washington.
Thank you, Mr. Chair. I would like to make a motion that we move items 1A, B, C, and D to next week's agenda.
Second.
Been moved and seconded by Councilperson Christensen. Any comments or questions?
Thank you for letting me do this. This is just a housekeeping thing. Items were sent in public notice to the folks involved in the assessment districts, and we just got a little confused in the calendar. It is all made right. They expect it to happen next week.
Okay. Any other questions? Okay, call a roll on item 1A through 1D, as in David.
Bowers.
Yes.
Christensen.
Yes.
Washington.
Yes.
Raybold.
Yes.
Schob.
Yes.
Ward.
Yes.
McGinnis.
Yes.
Motion carried 7-0. Next up we have,
Is there anyone wishing that anybody else would like to come forward to speak on any of the other items for our consent agenda? Okay, seeing none, we move on.
I'll be calling items 2A and 2C together. They're just the setting the hearing dates for liquor resolutions introduced by Christensen.
So moved.
Second.
Been moved and seconded by Councilperson Ward. Any comments or questions? Seeing none, please call the roll.
Washington.
Yes.
Christensen.
Yes.
Bowers.
Yes.
Raybold.
Yes.
Schob.
Yes.
Ward.
Yes.
McGinnis.
Yes.
Motion carried 7-0.
Okay. We can move on.
Up next is public hearing resolutions. Item 4A, accepting and approving the report of new impending claims against the city for February 16th through February 28th, 2021.
Is there anybody that would like to come forward and speak on this item? Seeing none, we can move on.
Item 4B, assessing liens for costs of registration fees and penalties for neglected buildings on properties generally located at 5320 Layton Avenue, 2958 North 54th Street, 5120 L Street, 1609 South 27th Street, 1641 South 6th Street, 3015 N Street, 1920 South 11th Street, 2626 North 36th Street, 922 South 20th Street, 234 South 38th Street, 3141 North 48th Street, and 1028 Furnace Avenue.
Is there anybody that would like to come forward to speak on 4B? Not seeing any. Let's move on.
Item 4C is assessing the costs incurred by the city for building demolition on properties located at 2626 North 36th Street, 820 South 9th Street, and 3015 N Street.
Is there anybody that would like to come forward to speak on this item? Seeing none, let's move on.
Item 4D, approving an operating agreement for SOFO Housing LLC, a Nebraska limited liability company.
We need a motion.
Yes.
Mr. Chairman?
Was there anybody that would like to come forward to speak on this item? We are going to remove it, but since it is scheduled for a public hearing, if anybody came down here to speak on this item? Seeing none, Councilperson Ward?
Thank you, Mr. Chair. I would move to remove this item 4D in its entirety.
Second?
Been moved and second by Councilperson Raybold. Anybody have any questions? Okay, please call the roll.
Christensen,
Yes.
Bowers,
Yes.
Raybold,
Yes.
Washington,
Yes.
Ward,
Yes.
Schob,
Yes.
McGinnis.
Yes.
Motion carried 7-0. And next we have item 4E, approving a resolution to end the declared state of emergency for COVID-19 in the city of Lincoln.
Councilperson Christensen.
Well, I want to let people know some background on this. First of all, I was going to bring this forward in August, and at that time it became clear there was going to be a recall effort, and I decided that I did not want this mixed up with that. My purpose in bringing this forward is there has been some misunderstandings about, and perhaps confusion about, what the emergency declaration is and what it is not. Sometimes confusing aspects of it with the directed health measures, mask mandates, those kind of things. And I think it's important we have a public discussion and give the city staff a chance to explain to the public what really is part of the emergency declaration and what is not. With that, give it back to the chair.
Okay. Does anybody have any questions or comments? Yes, Jane?
I'm hoping that we can get our city attorney, Johanse Christie, to come up and ask a few questions, and Jim David Saver, who's with Lincoln Lancaster County Emergency Management, if he's available, and maybe John Carlson.
Okay. Good afternoon, Mr. Christie.
Good afternoon, Johanse Christie, City Attorney.
Do we have questions for Johan? Yes.
Yes, I'll
Counsel.
go ahead and start a few questions. So, Mr. Christie, I know that there's been some confusion, like Councilman Christensen had mentioned. Can you just clarify, what is the difference between a directed health measure? Who has the authority to issue a directed health measure? Name some of the directed health measures that have been in place, and then I'll have a few more about emergency management too.
Okay, I think the directed health measure, the authority from that comes from the state statute. But the state of emergency declaration is in the Lincoln Municipal Code, 2.06. The duration of a state of emergency can last no more than 72 hours unless extended by council. That is the emergency declaration that is laid out in the Lincoln Municipal Code. Now, the directed health measures exists independently of the state of emergency declaration. The directed health measures, the authority for the directed health measures come from state statute 71-501. And then also in 71-1630, both of those statutes lay out the authority for directed health measures, and they talk about how the health departments shall make and enforce regulations to prevent the spread of contagious and infectious diseases. And then that's in 71-501. 71-1630 goes on to talk about how the health director shall investigate the existence of any contagious or infectious disease and adopt measures to arrest the progress of the disease. So that is the authority for the directed health measures in state statute. And then in the code, the Lincoln Municipal Code in Chapter 8.18, that is the Communicable Disease Act. That has some more enforcement and related powers that relate to directed health measures in 8.18.
Okay.
So,
Does anybody else have a question? Yes, Councilperson.
So I guess my question in regards to that is, what is the purpose or the intent behind the emergency declaration? What does that do?
So I'm glad that we do have Mr. David Saver up here as well, because he can probably talk a little bit more about emergency management system and kind of how that emergency declaration, how it works with that. But just generally speaking, the way that I would explain it is having an emergency declaration allows that affected municipality or county or state to apply for additional resources. That could be state resources or it could be federal resources. Resources including personnel. Not when I say resources, I mean possibly reimbursement, money, but also personnel.
Okay. Councilperson Washington.
Thank you, Mr. Chairman. Mr. Christie, before you step down, I am curious in the what you last week had sort of to lay out the kinds of ordinances that have been passed that are related to the emergency declaration that was enacted last March. Would you mind reviewing those? You can just list them so that they're top of mind again. So what has been the impact of the emergency declaration in regards to ordinances that we've passed in the last year?
Yes. If you just give me 1 second. I believe there should be, 8 approximately. The first ordinance, I think I referenced this last week as well, would be the moving from a biannual budget to an annual budget. And that was related to the emergency declaration pandemic. Second one, the council delayed the expiration date of current certificates of compliance. That was related to child care programs. The third one, there was an ordinance that the council passed early on about excessive retail, prohibiting excessive retail prices. The other one would be the special event permits. The council allowed special events to occur on Husker Game Day, so waived the prohibition on having special events on Husker Game Days. Also, the council waived the requirement for the 21-day notice for special events. Then there was so those two, and then there was the third-party food delivery fees as well. The council placed a cap on that. There was the temporary delay in permit, delaying certain permit expiration dates for food establishments. And then there was the temporary suspension of the tax, occupancy tax. That was also early on in the pandemic in March. Dine out has also been I believe that was executive order by the mayor, but the council's involved in that as well with allowing dine-out for restaurants.
Okay.
Thank you.
Any other? Jane?
I wanted to go back to the DHMs, if we could. Can the governor challenge the Lincoln-Lancaster County Health Department's DHMs?
Yes?
He can?
I mean, he could, the way I understand the question is, can the governor file a lawsuit against the city of Lincoln challenging the Lincoln-Lancaster County's authority? And I think the answer to that has to be yes. Now, the governor has not done that. That has not happened. But there's nothing that prohibits the governor from filing a lawsuit to challenge it.
What would be our defense?
Well, I think among lots of defenses, one of the things that would have to be presented as a defense would be the statute that I referenced earlier, which is 71-1630. Subsection 4 of that statute has language that is specific to the Lincoln-Lancaster County Health Department. And probably an easy way to think about the directed health measures is across the state, health departments are required to request permission from the State Department of Health and Human Services if they are going to issue directed health measures that are not the exact same as the state. So if they're more restrictive or less restrictive, really they need approval from the state. That specific statute exempts Lincoln-Lancaster County Health Department from having to obtain approval. So I like to explain it that way because I think it is important to understand that the rest of the health departments have to ask approval if they are going to do anything different. Not that they actually can't, the way that I read and understand the statute, which I imagine they do as well, or their counsel would agree. But Lincoln-Lancaster County, we are exempt from asking for that permission from the State Department of Health and Human Services.
I'm sorry, I was going to do a follow-up. Does the mayor and the city council have the authority to challenge a DHM?
I would say that anyone subject to the directed health measure can request a hearing.
The appeal?
So as a citizen subject to the directed health measure, you can always request a hearing. Same sort of thing with the governor. I guess anyone can try to challenge it.
Has anyone challenged our DHMs?
Yes.
Okay.
I would say that there's a lawsuit involving the, among other things, directed health measures right now.
Okay. Thank you.
Does anybody else? Yes, Councilperson Washington.
Madam Councilwoman, I just want to clarify a question because I've been under the impression that the DHMs don't belong to us, the city of Lincoln or city council, but that they are the health departments. I just want to make certain I have a clear understanding that the DHMs, the authority for the DHM is from the state to the county health department.
Correct.
And the city does not have authority to issue DHMs.
Correct. The authority for the directed health measures is with the is in state statute.
Okay, so
and it applies to the health departments across the state, and then there are the municipal code. Lincoln Municipal Code has further guidance for the health director.
Okay,
Okay.
thank you.
Yes, Councilperson Christensen.
Back to the idea of at hand, the emergency declaration. Are there other emergency declarations in place currently that pre-exist this one?
In the city of Lincoln?
Yes.
Yes.
And could you describe that and how long it's been in place?
I can tell you that there is a emergency declaration from 2019 flood that is currently still in effect.
And why would that still be in effect?
Again, I'm happy that we have Mr. David Saver here as well, but I think he can kind of talk about the response to the flood and the damage and ongoing effect, and being placed in the portal, the way I understand it, to be eligible to apply for resources, including reimbursement.
Any other questions for Mr. Christie? Okay. Mr. David Saber, if you could come forward.
I'll stay up here.
Yeah.
Good afternoon. Jim David Saber, Director, Lincoln Lancaster County Emergency Management.
Yay. Do we have some questions for him? Councilperson Rabel.
Mr. David Savior, I'm going to follow up on Councilman Christensen's. How many times do you know if we declared an emergency?
I've been the Director of Emergency Management since August of 2014, and in that time we've had city disaster declarations or emergency declarations for flooding in October of 2014, flooding in May of 2015, flooding in March of 2019, the COVID crisis that was in March of 2020, and then the civil unrest in May to June of 2020.
What does a declaration of emergency do for the city? What does it do for the county? Why is it necessary?
From the local level, it is the official notice to the state and ultimately the federal authorities that the city has encountered a situation that's going to need assistance and resources to respond and fully recover from whatever that incident is.
So could you talk a little bit about the flood? Have we responded to the flood? Are we now because the declaration of emergency is still ongoing for the flood, the recent flood that we had in 2019, is that correct? So are we in the response, or are we in recovery?
Hopefully we're close to the end of recovering from that. And again, I would defer to the Lincoln Water System because that's the primary entity that was impacted due to that flooding in March of 2019. So emergency management, it's my responsibility to ensure that the local authorities recognize that if we anticipate the need for resources, I'm the one that has the statutory authority to formally notify the state with the permission of the chief elected official. So when I'm dealing with the city of Lincoln, that would be the mayor.
So with the COVID crisis, where are we at with a declaration of emergency?
It's still needed, in my opinion, that COVID as a public health crisis, it's difficult to identify exactly when do we transition from response to recovery. And there are some who certainly think that we are actively responding to that public health crisis. And as such, what that standing declaration does is notify those state and federal authorities that we are still dealing with this and we need assistance, or we do anticipate needing additional resources moving forward until we fully recover from that.
Okay. Any other questions for Ms. Jane, do you have any more?
Sure. I just want to make sure everybody gets a chance. This is a question I think I asked Mr. Christie, but do you know, like in the state of Nebraska, we have 93 counties. How many of those counties have an emergency declaration right now concerning COVID?
When I checked late last week, there were still 90 of the 93 counties that had an emergency declaration related to COVID.
And the reason why other counties take on this measure is, I think I heard you say once, and I love the quote, maximize your eligibility. But your eligibility for what?
Correct. When we're dealing with an unknown, such as COVID, once you've identified that it has had a significant impact, that it's a threat to the health, safety, and welfare of our community residents, that's when you want that emergency declaration on file with the state and ultimately the feds. If you don't have that declaration, essentially the message to the state and the federal authorities are, we can handle this at the local level with the resources we have on hand. What that declaration says, and that's with COVID, I think it's kind of an open-ended one. It's saying we're dealing with it, and as we encounter twists and turns in this, we may need additional resources. For COVID, early on, it was PPE, personal protective equipment. It was scarce. We wanted to make sure that we had that in the possession of the first responders, of the healthcare providers, those who are dealing with COVID firsthand. Those supplies were not readily available within the city of Lincoln's inventory, so that's where it became necessary to ask for that assistance from the state and the federal authorities.
So besides PPE, what other assistance has the county or that you may be aware of the city that we've requested?
COVID is an interesting situation because it's not only a public health crisis that our local health department is coordinating its efforts with the state Department of Health and Human Services. In the emergency management world, I'm local emergency management. I've been working closely with NEMA, the Nebraska Emergency Management Agency, to keep them apprised of our current situation and any resources that we may anticipate needing. So that's where COVID, it's a different dynamic than, I hate to use the term traditional disaster, but when we think of the flooding, that's damage that occurred to the physical environment. So you can do your preliminary damage assessment. You can get an idea of what is the extent of this, what is our damage, and what do we need to fully respond and recover from it. COVID is that open-ended question. I would like to think we're getting reasonably close to the end with the vaccination progress that has been made. But if new variants are uncovered, if different wrinkles are, we need to extend the mask mandate, or we need to adopt some other measures to, again, ensure the health, safety, and welfare of our community, we want to make sure that we have that standing declaration in place that should that need arise, the state and the feds are ready to address it.
Thank you.
Councilperson Christensen.
Yeah, in your opinion, what conditions would need to exist before you would be comfortable with removing the emergency declaration?
The one regarding COVID, I would have to defer to the subject matter experts, and that would be Pat Lopez, the director of the health department, and her team. I can go on with a longer explanation, but in the incident command world, Pat assembled a unified command team that's been in place for a year. It has the representatives from the health department, from emergency medical, law enforcement, the cities, Transportation and Utilities Department. You want all those subject matter experts meeting together to identify what the problem is, and then collectively, what do we need to do about it? So when we're talking about a public health crisis, I defer to the experts in public health. When is Unified Command comfortable with rescinding our local declaration?
Okay. Any other questions, comments? Councilperson Ward.
Thank you, Mr. Chair. I guess I would ask if we have anybody present from Unified Command that could add to your testimony. I don't know if anybody from Health Department or LTU.
I was going to say, I spoke with Chief Jackson earlier today. I don't know if he has an opportunity.
I think you're right. I think it's to add to, it would be helpful for us to add to that answer when it is appropriate to Councilman Christensen and Councilwoman Raybolt's questions when we could consider at appropriate time. So I think while we're looking, thank you.
Okay.
I think Mr. Carlson went to look for somebody.
Or maybe, yeah.
I didn't see any, so.
Well, I have a question of the chair. I didn't know if we wanted to talk about rental assistance, food contracts that have been made by the city, or childcare assistance, particularly the housing assistance for evictions, or if you wanted that to wait till after we hear testimony from folks.
We could wait, and
Okay.
we could have, if you want, we have a mayor's representative here.
Well, I just wanted to know if you wanted me to hold off and wait so that we hear people to testify.
That'd be fine. What do you guys think? Well, let's do it now while we're up here and calling up the experts, calling them up, so.
Okay, all right. Could I ask John Carlson to come forward, or Dan Marvin to talk a little bit about housing assistance and the food assistance and some of the contracts that the mayor has issued for temporary housing?
specific to that question, I'd probably ask Dan to come up.
Mr. Marvin?
Director,
Good afternoon. Dan Marvin, Director of Urban Development. Our department is administering, with a coalition of partners, a rent utility program that continues to pay out. The last time we had a report would have been from last week. We paid out about $135,000 last week for people who are struggling under COVID to pay their rent or their mortgages or their utility bills. We have a number of intake partners that take those applications. They're funneled through CCFL, the Center for Children's Family and the Law at the university, and then approved for payment. And we're continuing to do that. And we have received some funds in January. We received $13.45 million towards that goal. Those were wired in the end of January, and we're continuing to pay those dollars out. I was listening to this, and I don't pretend to be an attorney here, but the one relevant thing that I did hear towards that goal, this on the rent utility funds, the funds that we receive from the Treasury are a part of an allotment that went to the state of Nebraska in the amount of $200 million. So we received the 13.45. Douglas applied separately. The state is working off of the balance of state that they have is about $158 million. The conversations that we have had with the state in regard to these funds is they have an expectation that the city of Lincoln will exhaust their resources and that they would expect that at some point we would ask for replenishment of funds. They don't know if that's going to happen. I can't say whether that will or not, but that we have had those conversations with the state.
Councilperson Christensen.
So the emergency funds that have come through the state to the city, are these possible because of the state of the emergency declaration, or would they be happening in the absence of it?
The 13.45 we applied for and were allocated because our population is over 200,000, and they were paid directly to us. And I can't speak to. I mean, I can play attorney for a second, but I don't know that the declaration would have had any role in that at all. What I can speak to is what I was hearing out in the other room was that we would, by having a declaration in place, that we would be able to apply to the state. The state does sit on an additional $158 million, and whether we were to exhaust our 13.45, whether this declaration has any role in that or not, I don't know, but I do know that our conversation with the state is that they would expect us to exhaust our funds, and they would expect that at some point in the future that we would need to be able to go back to them and ask for additional resources.
Okay, Councilperson Rabel.
But I guess the funds that the state received, how were they allocated to the state? Were they based on the state's declaration of emergency that is still in effect?
No, the bill that was signed by then President Trump allocated $25 billion in rent utilities, and Nebraska is considered a small state, so the small states received a minimum of $200 million by the vote of that bill, and the balance that the state has are the resources that excluded Douglas County and Lancaster County.
Okay, but I guess the question I was trying to ask, was it all part of a broader COVID relief package that was passed to help states deal with whatever crisis that they were encountering when it came to COVID-19?
I know that I'm familiar with the legislation about the $25 billion that was approved, that we received in January. I can't speak to the issue as whether it was strictly COVID related. It appears that all the states received a certain allocation of those funds.
Any other questions for these two? Yes, you have.
I have more questions for John, maybe. I don't know. I'm looking at a list of executive orders that were issued by Mayor Gaylord Baird, and I don't know if they're related to our emergency declarations, like a contract agreement with the National Association of County and City Health Officials, getting more PPE, and another with the food bank on the purchase of food in response to food shortages, or an agreement with Staybridge Suites for emergency temporary housing for those that have to quarantine, or and again, another temporary housing with Big Red Hotel. Also, People's City Mission relating to quarantine of housing, contracts, reaching out to them, and contracts for more isolation gowns. I guess, is this all related to our declaration of emergency, being able to call upon these funding?
John Carlson, Mayor Gary LaBaird's office. I think probably the underlying fabric, the underlying theme between all those things, though, is the emergency declaration's ability to create additional flexibility and agility in the purchasing process. Because what I heard in most of what you talked about was our ability to move quickly for those things that needed to be done, whether it was housing, whether it was PPE, whether it was other things. So again, like Dan, we want to get the specifics on what authorizes what, but in general, the underlying theme to that seems to be that the emergency declaration gave us the powers to move much faster and much more flexibly in a lot of different circumstances.
Okay, thank you.
Any other questions for?
Yeah.
Yes, Councilman Christensen.
Well, I asked a question earlier that really wasn't answered, and I can see why it maybe won't be answered today, but I'd like to get an answer as to what conditions need to exist before the emergency declaration can end.
Right.
So people know, what does the goal line look like?
Right.
And when have we gotten to it?
Right.
So, and I've been told that there's this group, and I appreciate that, and wonder if we can get an answer from them.
Yeah, incident command, absolutely.
Yep.
And what I will say overall, though, is that I think when you have a situation like COVID, that's really a kind of a moving crisis, and we certainly are making traction, and we are taking steps on it like that too. And since it's a novel virus, so again, I'll defer to the subject matter experts, but I think the issue becomes they're dealing with conditions day by day, week by week, month by month, because conditions evolve throughout the community. So they will certainly ask that question, and we'll get the answer that they get back. But I do think we all need to be mindful that it may not be as simple as repairing a well, right? Obviously. It's going to be much more complicated than that. It's going to be much more nuanced depending on where we are with the community conditions.
And that's why I don't necessarily expect an answer to that question today.
Right. But I do appreciate you bringing up earlier the notion about the separation of the DHMs and the safety measures with the emergency declarations, because they clearly are different, because the DHMs tend to move along with the dial, and so they tend to be tied to the community condition as well. So as Lincoln continues to improve, those safety measures begin to be relaxed somewhat. They're still in place, obviously. We still want to cross the goal line as you talked about. But I think that's another indication of how those two are separate items. So the DHMs exist, and they're implemented by those subject matter experts in response to the particulars of the community conditions. Whereas the emergency declaration, as again, City Attorney and Director David Saver pointed out, really are about enabling this recovery and response operations. And that, I just wanted to make sure that I had a chance, since I don't often necessarily have a chance to say, in response to the initial passage of the declaration, to continue to thank the council for doing that, and for the ongoing work that you do and have continued to do during this pandemic, all of you, and not only council but city departments, the entire community. So I want to make sure that I take just 10 seconds here to thank the public for all the work that we're doing. We do recognize it's difficult, not just for the council, but for the entire community. Those are hard steps, but they're critical steps. And when you see the data and the outcome of those hard steps, those individual steps, not only by organizations, but by people every day taking the safe actions they need to take, that's why Lincoln continues to be a healthy place and a strong place, and why we continue to recover in the face of this pandemic. So just want to take a moment to say thanks. And why we hope that we will continue to have the declaration open so we're able to continue to respond.
Any other questions for Mr. Carlson? Thank you for coming down. Did anybody else would like to hear from any other staff at this point? Okay, we can move on to the public hearing.
Mr. Chairman, I was pointing to Scott Holmes from the Health Department. I think there was a earlier request.
Rick Task?
I'm sorry, Rick Task. That was Rick Task.
Yes.
That was Law, sorry. I saw Scott.
Okay. We're fine. Okay, go ahead and we'll work on the sign-up sheet, correct?
Yes, today we're going to call names by the order that they signed in. So first up is Roy Helm, and then up next is Cinnamon Doken.
Good afternoon. Roy Helm, Helm, 2750 South 13th Street. I'm opposed to this resolution and am very convinced that we need to maintain our emergency declaration. That there is too much more work to be done, and we cannot shoulder the burden as a community by ourselves. We need the ability to reach out. We need not be afraid to ask for the help from other organizations, entities, levels of government that are out there. There are resources available, and we should take advantage of that. As I believe Governor Ricketts said in another matter, there's a lot of Nebraska money, tax money being bandied about, and we need to make sure we keep what we can and what belongs in Nebraska. And by maintaining the emergency order, that provides us with an avenue to do so. This crisis has been very, very taxing for all of us. It's been so challenging. And when we think about where we were a year ago and what the numbers were, and the numbers in Lincoln, Lancaster County were very low, almost non-existent. And there were actions taken to prepare us and to put us into an emergency, under emergency order, under emergency health measures, and there was a lot of pushback for that. It did cause a lot of duress for individuals and businesses. But because of that, and the good work that was done, and the hard work that was done, the difficult work, the gut-wrenching decisions, and the determination of the citizens, we have remained fairly safe. Our numbers are better, and we can look at the numbers today and say, yes, they are improving, they're sliding down, they're getting better. Maybe we can remove ourselves from these concerns, but that's compared to what? The highest peak? They're still frightening to me. As I've stated before in this chamber, my wife and I both had COVID back in December. It wasn't debilitating for us. We got through it. We still don't know what the long-term effects are going to be, and that's going to be a mystery. Because of those concerns, I stand here hoping that we can still pull together. There has been a lot of sacrifice made. There's a lot of economic sacrifice that has been made, and part of that recovery will require outside assistance. And the emergency declaration provides our city the ability to provide some support to the citizenry. This is just too important. We're at too critical a point in dealing with this plague. We need to come together. We are close, and we need to think as a community, not as individuals. We need to be willing to make that sacrifice for just a little bit longer, and we need to have the humility to admit that we need help and that we're willing to receive help because it is for our community. I have been so touched by some of the news reports that show people in assisted living getting their COVID vaccines and now finally being able to see their family and loved ones after a year. They effectively are being released from incarceration.
I have been talking with some of my friends who have received their COVID vaccinations, and the conversations excluded me until Saturday, when I had the good fortune, out of the blue, to have received the Johnson & Johnson vaccine. I now can join those conversations about having face-to-face contact. I've just been released in 2 weeks from house arrest. This is liberating, but we need to make sure that we keep the funds available and keep our access to funds that can provide us the personnel, that can provide us the vaccines, that can provide us the locations to receive the vaccines. This is too important. Too much has already been lost to give up now. It's
Could you wrap this up?
yes. I didn't hear the bell go off.
Yeah, she had a quiet bill.
Okay. Well, with that said, this is a very emotional issue, and it should not be a political or partisan issue. So please oppose this resolution. Thank you, and be safe.
Okay.
Up next is Cinnamon Doken. After that would be Samuel Wine.
Hi, good afternoon. I'm Cinnamon Docken, and I reside at 1445 South 20th Street here in Lincoln. I'm also the owner of a Novel Idea bookstore, which is now in its 30th year downtown. I wanted to urge you to maintain the emergency declaration, please. We have all worked so hard over the past year, really leaning in and being responsible. We are in the home stretch, but we are not there yet. And, just on February 26th, in the Raleigh-Durham area of North Carolina, they relaxed DHMs. And now, Duke University is completely quarantined. They had a big spike in cases. Their basketball team is out of the tournament. We don't want to make that mistake. Let me say, though, that Raleigh did keep their emergency declaration. I bet they're glad for it now. And I was glad that Mr. Christie and Mr. David Saver both discussed the difference between the DHMs and the emergency declaration. As a business owner, I'm used to leveraging just everything I've got, for the good. This is good leadership. This is what we want to do here. I don't understand why we're even having the conversation. We don't want to shoot ourselves in the foot by making ourselves ineligible to quickly access state and federal funds. We have all paid our state and federal taxes, and as the previous speaker mentioned, we do want to hang on to that. We want to be able to access that when we need it. It's just crucial. And I also have to say, and with all due respect, I'm disappointed in Mr. Christensen here for bringing this resolution up. And I'm glad to hear you say at the beginning of this meeting that it was about having people understand what's involved here, the differences between the DHMs and the emergency declaration, because those are vast. However, I've been reading in the paper that it's all about the mayor somehow, and it's just not. This is really about keeping our options open and protecting our community, making sure that we have the resources that we need when we need them, should we end up like what they're doing in North Carolina. And I feel that we've had so much of that in the national level, this kind of mischaracterization, and we don't want that here. We don't need that here in our community. I haven't been around so many people without masks on for a year, and it's unsettling to me. I have an underlying condition, and we just don't need this stirring up this distrust of our government. Council has worked so hard. Business leaders have worked hard. Let's just stick with what we need to do. We need to keep all our resources open and available to us. We need to maintain this declaration of emergency. Thank you.
Thank you. Okay.
Up next, Samuel Lyon. After that, Robert Way.
Samuel Lyon, Lincoln, Nebraska. It's good to be able to come today and speak on this topic. The first time in nearly a year. Tomorrow marks the anniversary, the 1-year anniversary that this declaration was that began. And thus far, the public has been excluded from having a conversation on this for a year. I'd like to thank Councilman Christensen for the resolution and also for your statements today, basically asking, what's the end goal? When will we know that the fire is out, or when will we know that this is over? And for a situation that started with 2 weeks to bend the curve, and then a month, and then 3 months, and then 6 months, which with a constantly changing goalpost, I think that's a very pertinent question, and a question that all the public wants to know and would benefit from. Because without a specific goal, it can always be extended. And so while we know that it's difficult to be in a position of authority and making those decisions, expressing and bringing the public into those decisions is what's necessary to keep the public on board, to keep the public apprised of what's going on, and to bring them into that conversation. And that's what I want to talk a little bit about today. So far, the public deserves to be part of the conversation, and so far the public has been excluded from that conversation. On March 16th, a year ago tomorrow, the rules were suspended in order to immediately bring forth that resolution. And I get it, it's an emergency declaration, you want to do it right away, but the public was not given an opportunity to speak on that day. There was no public hearing on that original declaration. Not that anyone would have been prepared to speak on it if there had been. But maybe a week or 2 weeks after that, the public could have been given an opportunity to have a public hearing, but they weren't. No public hearing was afforded to the public. Fast forward to December, Councilman Christensen offers a resolution bringing this needed conversation to the public. By that time, many of the public were growing weary and wondering, what is the end goal? If you put a cast on my leg and you tell me, well, I'll take it off when I take it off, I would be a little upset with the doctor and want to know, what's the end goal? What are we looking for? That resolution was immediately blocked by Councilperson Raybold and company and sent to purgatory on the pending no date certain list. Councilman Christensen then later attempted to withdraw completely the resolution in order to allow the public to speak on it, taking it completely off and getting rid of it just to allow the public an opportunity to speak. That attempt was also blocked by Councilperson Raybold and company. Then several in the public attempted to speak about the emergency declaration at an open mic session and were again blocked through point of orders and parliamentary procedure by Councilperson Raybold and company. Some even alleging that any topic ever to be taken up by the city council in the past can never be talked about by the public at open mic in the future. In recent weeks, at pre-council meetings, when you've had Mr. David Saver and the attorney up here, it's been expressed to them that the council should email questions regarding the emergency declaration to them in order to have a more thorough explanation the next week. However, the next week came and it was expressed that those emails were replied to by Mr. David Saver and the attorney eliminating the public from the conversation. As I was waiting to listen to it the next week, it was just replied to. I talked to Mr. David Saver, I talked to the attorney, and they declined to send me those emails where the questions were given and the questions were answered to. As a member of the public, I can't ask those questions, only a city council person, and now I can't even see the responses to those questions. And so I think that it's important for us to remember as we look forward to have the conversation, to know what the end goal was. I spoke with Pat Lopez earlier today, and she was not able to articulate specifically what the end goal would look like. She mentioned vaccinations, but didn't have a percentage, a lower case count, but didn't have a number. So I think what we need to remember is ending the emergency declaration is not giving up. It's an expression to the public that the worst is over, and it's important to know what that goal is. Thank you.
Thank you, Mr. Lyons.
Up next, Robert Way. After that, Robert Bohr.
Just 1 second, please. My name is Robert Way. I live at 7140 Adams Street. A few comments on history and timelines. Initially, this resolution, according to statements made here today, was going to be brought up in August. The worst day for new cases was November 20th, 2020. The worst case for deaths was January 14th, 2021. While discussion of any matter is always appropriate, that's why we have deliberations, that's why we have a council to hear such items. The idea that deliberation should lead to immediate results, I do not believe is currently held by the majority of Lincoln residents. I believe not even by a significant minority of Lincoln residents, because despite claims that the public has somehow been excluded from this conversation, Lincoln citizens availed themselves of their civic rights and brought this quite publicly and quite flamboyantly and quite well done from a street demonstration point of view to the Lincoln citizens through Lincoln Recall. They were not able to gain the necessary signatures. That's fine. Just because you didn't get your necessary signatures, you still have a voice. You still have a voice here. But that doesn't mean because you have an opinion and you're passionate about that opinion is overriding everyone else's opinion. Regarding more to the point, there seems to be a concept in this debate that somehow these restrictions are affecting our freedoms. That somehow it's un-American to worry so much and that people should be allowed to do what they want and we don't need a babysitter. Well, if you take an originalist view of the Constitution, you go back and look at the history. And the history of the Constitution was, the Bill of Rights was ratified in 1791. In 1793, Philadelphia came under the yellow fever plague. They didn't know it was the yellow fever back then because they didn't understand medicine, but they did their best to try and deal with how they thought they could fix the problems. And because even back then government was slow and took a while, in 1799 they actually installed one of the first public waterways in the city, because even though they didn't know the scientific basis, they realized that clean water would lead to healthier outcomes. One of the people who was involved in that decision both treating and doing the recommendations was Benjamin Rush. Benjamin Rush was also one of the people at the Constitutional Convention. So even our founding fathers understood that government, A, has a place in health crises, that you take what steps you can, the best steps you know, and then later you look and you see how you can keep that situation from occurring again. I believe that's my time.
1 minute.
Thank you very much. I thank the council for holding this meeting. I thank them for listening. And I hope you all have a pleasant day.
Thank you.
Up next, Robert Borer. After that, Rachel Brock.
Robert Borer, Lincoln, Nebraska. I have to plug in here. While I'm plugging in, I wish somebody would show me where this big bad boogeyman is, because I've been looking for him for a year now and I haven't found him. I've been halfway across the country and back a couple of times. And I believe Benjamin Rush was opposed to medical tyranny. Anyway, so I had a lot of material to whittle down. I really worked hard on it. So if I go over a little bit, please indulge me. I won't waste your time. All right. Seems this guy made a big impression on most of you last Monday. You might have gone home thinking he gave you what you needed to continue justifying your unconstitutional and criminal behavior, depriving we the citizens of a government of we the people. I wouldn't be surprised to hear that some of you found yourself in a wet dream later that night. So here's Mr. Ronner's graph. How many died in Mr. Ronner's graph? Pray tell. And what were their so-called contributing morbidities, if any? What are the demographics of these populations? Did they follow the rules or defy them? Moreover, what proof does this graph offer that anything we've been doing here in Lancaster County is causing a lower death toll? Does this graph prove that closing businesses, schools, and churches is responsible for our alleged success? Does it prove that health comes from being a germaphobe, from hiding behind a mask, from using sanitizing liquid every 5 minutes, from being afraid of and staying away from people, from getting an injection? Here's a conversion of Ronner's graph that makes it easier to understand and less scary. Plus, there are no trends implied here. If this scamdemic has taught us anything, it's that the fake predictions of the public health idiots in charge never pan out, because they were never meant to pan out. They were designed to test whether you had backbone or not, whether you had critical thinking skills or not, whether you would simply comply or not, no matter how ridiculous things got. Because it was never about health, but about power, money, and control. At no time in the past year has there been a real public health emergency that wasn't caused by constant government fear-mongering and isolation policy. The virus was and is the government, and the fear-mongering narrative was a self-fulfilling prophecy, just as it was intended to be. Look at the y-axis, 0 to 1%. Every line on Ronner's chart is represented here. Every death toll on his chart is below 0.25% of the respective population. The sky is not falling, I'm sorry, here or anywhere else. The difference between the highest death percentage, South Dakota, and the lowest, us, is minuscule. It's a mere 0.146%. You guys can all see this on your screens, can't you? Okay, thank you. The total deaths represented by all lines in Ronner's graph, and now these bars of mine, is 9,694 deaths out of a total population of 5.9 million people. That's the combined population of Iowa, Nebraska, and South Dakota. Now let's contrast these numbers with all-cause mortality for each state. Again, look at the y-axis. All-cause mortality is between 1.15 and 1.25 for each state. Alleged COVID mortality sits beside it. In other words, you can easily see that there are a lot of other causes of death, some of which far outweigh the COVID boogeyman. What might some of these be? Let's look at Nebraska. Cancer and heart rate and heart disease, for example. The time period here is the same as previous graphs. The death toll of these diseases is obviously higher. Even if the deaths weren't higher and only the same, the question arises, why haven't we forced our way into people's homes and lives under color of law and required them to eat healthier and exercise more? Isn't grandma worth saving from cancer and heart disease? Isn't it worth giving grandma a few more days, months, or even years? Or is all of our COVID virtue signaling just more fakeness? Here are the number of deaths each column represents. Cancer, 4,000. Heart disease, 4,000. Apparently, COVID isn't strong enough to kill anyone. I'm going to zip through to my closing statement. Because it needs comorbidities. Look at this graph. 92% of COVID mortality is over 54 years old. Same with another chart from the CDC says the same thing. Some of your comorbidities. And notice the fine print here. According to the CDC, comorbidities are listed on 94% of COVID death certificates. The 6% that didn't include a comorbidity were likely the problem was likely related to a lack of detail about other conditions present at the time of death. Okay, and the other one is obesity. I got some great quotes. Obesity, 90. Excuse me, I'll get to one quote here. Back up. By the way, Colorado beat us in all metrics. Colorado is number one in obesity ranking. Nebraska's 33. That should tell you why we have more deaths than they do per capita. Okay. I'm going to my closing statement. Jane, you're front and center. Okay, my closing statement. Back in March, you all broke the rules. Suspend is just a euphemism. And if you can break the rules, so can we. And as I was saying, you broke the rules and happily gave Baird, our local tyrant-in-chief, an open-ended emergency where there was no actual emergency at the time, nor has there been one since. You did this without public input. It obviously was a decision that was made prior to the council meeting. I don't know how that wasn't a violation of another violation of the rules, namely the Open Meetings Act. You tout every session, but that's beside the point. The point here
Can you
is
wrap
that,
this up?
Yes, I will. Is that the point here is that it's way past time to end this charade. This is not about science. If it were, we'd have a debate because the scientists don't agree, and then people could make up their own minds. No one is forcing anyone into the public square. Treating people who are not sick as if they are sick by forcing them to act sick is evil. The state of emergency is a sham and a scam, and it's being abused. It constitutes enslaving our children and grandchildren to Baird's lust for power, control, and cares money, and to your ineptness.
Wrap this up? We're way over. And if you've got these, you can send them to us so we
I'd be
can
glad
finish
to.
reading them for you.
Okay, here's my last.
No, we're pretty much.
Point of order. It's no longer a point of order. Look at your
Not a
screen.
point of
It is a
order.
point of odor. The stench of tyranny fills our nostrils. And you guys ought to realize that right there, gun sales were, because our sheriffs have failed us, our council has failed us, gun sales were highest they've ever been in history. Thank you.
Thank you. Next.
Up next, Rachel Brock. After that, Abby Fougeron.
Hello, my name is Dr. Rachel Brock. I'm a nephrologist here in Lincoln, which means that I'm a kidney doctor here. I am also the department chairman of nephrology at Bryan. Wanted to just open up and tell you that while I share enthusiasm at the same level as the prior presenter, I want to reorient back to reality and talk about how I have the opposite viewpoint, not one of graphs and charts, although you'll hear a lot from my colleagues today about the science behind why we're concerned, but one based on my tangible experience, which is a day-to-day dealing with families, patients that are suffering from COVID, okay? So first and foremost, I want to thank you guys for your attention today and for your tireless dedication to serving the Lincoln community. As doctors, we share with you the responsibility for making sure that the people of Lincoln are safe and that they're healthy, and that's why we stand here today. We are grateful that the COVID numbers here in Lincoln have improved. We also are anxious to get back to date nights and to hugging friends and family, sleepovers for our kiddos, and of course, to tailgating into Husker sports, right? But we're not done here. We're not safe yet. This is still an emergency. The emergency declaration is in place because the unknown is still unknown. It's still occurring. The risk has not suddenly disappeared because we've begun vaccination. The declaration should therefore stay in place. We do not have enough people vaccinated in this community to let down our guard yet. We've come this far. To let up now puts us at risk for undoing all of the hard work and sacrifice that we've all endured thus far. We, as doctors, have spent our lives dedicated to protecting and improving the physical and the mental health of others. Medicine is our job. Taking care of the sick is our responsibility. We knew that when we signed up and applied for medical school. But I wanted to talk about a less talked about aspect of COVID, which is the burden that this virus has placed on us, which is the medical community of Lincoln. You're going to hear a lot from my other colleagues in medicine today about the science and about our concern from that standpoint. But we, the docs, the nurses, the custodial staff, the chaplains, all of us who have been first line in caring for COVID patients and their families, we're exhausted. We're exhausted physically and we're exhausted emotionally. We have been dedicated. We have been very tireless. We have not rested for basically 15 months at this point. We, the healthcare workers of Lincoln, have no intention of abandoning our duties to the medical community and to sick patients. But we cannot endure another large spike in the numbers, not from a medical resources perspective, not from an economic perspective, not from a caregiver burden perspective. We are not done here. You all trust us enough to care for yourselves and to care for your loved ones. Then you need to trust us when we all tell you that this is still an emergency. And that to protect and support, that for us to protect and support our patients, you all need to continue to protect and support us. And the declaration helps with that. Thank you for your time today.
Thank you.
Up next, Abby Fougeron. After that is Brian Bassard.
Behalf as she couldn't be here. So I'll be speaking in her tone. So I am writing to you as a healthcare provider in the pulmonary field, but also as the parent of a young child with a chronic disease. Do you want to look back in a couple of months and think, wow, we should have waited a little longer to keep everyone safer? Or do you want to look back and say, we kept more people safe and healthy as we continued to work through this pandemic together? As a provider, I have had numerous patients recently seen in follow-up that are doing well and have stable pulmonary disease when normally they had been dealing with exacerbation symptoms or worsening shortness of breath after an upper respiratory illness. They attribute this to wearing a mask and social distancing. They are relieved when they have gotten their vaccinations or they are anxious to get theirs in the coming weeks. While there have already been numerous vaccination clinics, we still have a large number to reach. A majority of my patients know things are getting better, but they do not want to risk becoming ill and would rather wait until more people have been vaccinated to keep each other safe and healthy. As the mother of a child with a chronic illness, I fear for what could happen to her if she would get sick with this virus. Not much is known about the effects on your children with autoimmune diseases. I do not want to see things take steps backwards should we decrease safety measures too soon. We do not want to go back to last year when parents had to decide who would get to stay at the hospital when their child was sick. We've all worked hard to keep our patients and families as safe and healthy as possible this last year. Let's keep each other safe, especially our children who cannot protect themselves, by continuing to follow the recommendations we have seen provide better outcomes. We will get there, but we need to continue taking gradual steps forward rather than risk going backwards. Thank you for your time.
Thank you.
Up next, Brian Bassard. After that, Mark Gill.
Ryan's no longer here.
Okay.
Okay.
Mark Gill. And after that, we'll have Jeff Jarrett.
Sorry I wasn't here last week. I understand it was an exciting meeting. I'm 13 days post-op for a new knee, so I'm a little slow getting around still. I'm not here before you today to deny any of the medical expertise, emergency management expertise, or any of that. Do any of you know what this is? Okay. This is a ticket to freedom. Wearing this, I can magically enter any business, any medical facility that I have business in the city of Lincoln. Without it, I have to stay in my car in the parking lot. That's because of the emergency mandates that were issued. This mask and every other box that I've looked at containing masks, except for maybe the N95, says it's made to stop dust, not disease or viruses. It will stop spittle because it is a physical barrier. I can send the church, the priest lights the incense, instantly I smell it. I guarantee you that aroma particles are much smaller than the coronavirus. Speaking of the coronavirus, there are like 27 different variants right now of coronaviruses. We're not going to fix that with a vaccine. I've been exposed to it, never had a symptom. I was lucky. My wife is autoimmune. She was exposed at the same time. Not a symptom. She was, I would say, on hydroxychloroquine for her lupus, but not one symptom. We have a niece living with us who is not on any medication, no precautions. She also did not experience any symptoms. So I'm thinking that maybe not the danger of the virus to people who contract it but I think the actual virus itself is a little bit overhyped. We're dealing with people that have comorbidities. Yeah, it's smart to try to avoid coming in contact with the virus. If I really want to avoid the virus, I'm retired military. I've been living in Nebraska, and I'm sorry I didn't tell you. I live at 1621 Kennedy Drive here in Lincoln. I've been living in Nebraska since I retired from the military in 1989. In the military, we call NBC gear and mask, nuclear, biological, and chemical. That would stop corona. That would stop nuclear radiation. It would stop various chemical agents. This will not. But because of the emergency declaration, this is all I need to get around the virus. I can walk in anywhere I want as long as I have this on. My wife can sew me a cloth mask, which is probably least effective at doing anything other than stopping me from breathing very well, because I've tried her mask. It don't stop anything except for adequate respiration. A young woman earlier mentioned universities, things like that. Universities is a different environment. You have people from all different communities influxing in these universities. Here a while back, we were in danger of losing the state tournaments because of the corona restrictions in the city of Lincoln. Well, we decided we could drop some of that and allow them to go ahead and have the games. They were looking at Quest Center in Omaha. The money was going to go to Omaha. And the federal funding, that was already provided early on by President Trump to each of the states. Lincoln could have applied to our governor for funding, with or without a state of emergency. Our governor's pretty generous at giving money where common sense tells him it's needed, whether it's for flood, whether it's for a pandemic or whatever. What I have seen more than anything else during this coronavirus is the amount of control of the population that it has been used to gain. During this last election, they couldn't believe their luck. You got an election that they were probably dead set going to lose, but lo and behold, here we got this virus. Now they can just mail-in ballots, mail-in ballots, mail-in ballots.
1 minute.
All right,
Thank you.
And, you know, the election outcome, I don't care what they say, it will never be settled one way or the other, whether it was valid or not. And I'm not here to argue that. But they used it as a tool, though, to go ahead and slap control on the people. And I'm asking you to lighten some of that burden, unless you're prepared to hand out NBC masks, military-grade NBC masks, to each man, woman, and child in this country. This is a farce. It's a free ticket, but it's a farce. And I would ask you to consider lightening the restrictions. It's odd that the mask mandate was extended to April 12th, which is just 6 days post-election for the primaries. Thank you very much.
You bet. Thank you.
Up next, Jeff Jarrett. After that, Daniel Smith.
Good afternoon, Jeff Jarrett, 6627 South 67th Street, Lincoln, Nebraska. I don't know that I've ever seen so many doctors in one place except the hospital, so to garner that much activism from us when we're busy in the hospital should speak volumes. I am a pulmonary critical care doc. There's 13 physicians in our group. We have 13 mid-levels, and so we are the ones that get consulted when people are suffering and dying from this virus. Have a statement that basically encompasses the sentiment from our group. You'll hear from hopefully a couple other of my partners who are here as well. So we are past a year of the start of this pandemic and past our initial efforts. We now have plentiful PPE. We now have the vaccine. Since the onset of vaccination, we have seen a significant downtrend in the number of cases and the number of deaths. The sustained decrease in cases and hospitalizations is partly due to the directed health measures in Lancaster County and throughout the state. We are seeing progress, finally, in the right direction. This is what gives us our hope to continue. This is a cautionary tale. We now have the variants in the world, here in the state, here in the city. They are threatening to steal this progress that we have been making. Neighboring states throwing caution to the wind, opening up their business and activities as if they have never experienced a setback that comes with pretending the virus isn't still holding our communities hostage. Relaxing these measures too soon is a public health mistake that we do not need to make here in the city or in the state. We are vaccinating the community. It takes time, thanks to the resources currently provided by the DHM. More work needs to be done. More people need to be positioned to support these efforts and all of the resources that come from these DHM. We're hopeful we can get in front of the variants and in front of this disease if enough people continue to become vaccinated in the upcoming weeks and months. We don't like wearing the mask either. We miss the date nights with our loved ones, wives, etc. Ending the public health emergency now would erase the progress we have made. Without the resources from these public health directed measures, our state's vaccination efforts will continue to struggle to keep up the demand. There's numbers that have been discussed about what's the magic number, etc. We're thinking 60, 70, 80%. There is no number. I don't know that you'll ever have a set date of when this is over. It's over. What we do know, without masks, it will continue. Nebraskans have stood strong together throughout this pandemic. The mayor and the Lancaster County Health Department have had to balance multiple difficult decisions for the greatest good, and the medical community stands firm in support of their efforts and their decisions. We cannot relax these efforts when we are on the last leg of this race. We are almost there. The end is in sight. We need to continue to request that we keep these public health emergency declarations and mandates in place and continue with the diligence that has brought us to this current state of hope. From a personal perspective, I thought I was going to agree with the majority of what he was saying, that this gives you freedom. I believe it does help. I'm around Corona in the hospital with massive different support. We went to state wrestling. I only went because I am confident that the majority of people will be masked. We went to the home builder show. I'm only confident because other people are going to be masked, are going to be there. If I feel these are relaxed, I'm not going back out. So you have to, again, it's not about me, it's not about one person, it's the community trying to shut this down, get to the end line, get people vaccinated, and move on. Thank you.
Thank you.
Up next is Daniel Smith. After that, Lance Schupbach.
obviously not Dr. Smith, but I am Joan Anderson with the Lancaster County Medical Society. Dr. Smith had to leave, and so he has sent me his testimonies that I would like to read. Dr. Smith is one of our infectious disease doctors here in Lincoln, very, very knowledgeable, kind of as you will see others as well. I'm Dr. Smith, one of the infectious disease doctors in Lincoln. I'm extremely worried about ending the state of emergency. It is still very much needed. The pandemic has not ended. Positive cases have plateaued in Lancaster County, which is great, but we live in a global society, and the pandemic is worsening in other parts of the world. It's only a plane ride away. Numerous variants have emerged. Some are already here in Nebraska. 8 cases so far as of today, and I expect more tomorrow. Vaccines are in general tended to work as well as your natural immunity works. Pfizer and Moderna vaccines don't seem to work as well against a couple of the variants that are coming our way. There are reports of patients who are originally infected are getting reinfected while the variants are not getting lasting immunity with the natural infection. Actually, I was notified today, Italy is going to lock down today due to a surge in cases with these variants. We are at a critical point, and ending the emergency declaration is extremely premature. We need to focus on increasing our vaccination efforts as well as opening up slowly as the health department has guided. Thank you.
Thank you.
Up next is Lance Schupbach. After that, Sean Truck.
My name is Lance Schupbach. I'm an internal medicine physician practicing hospital medicine at Bryan Health for the past 14 years. I'm a son of a Lincoln retiree, a parent of 3 Lincoln Public School students, a spouse of a University of Nebraska educator, a Lincoln resident, a taxpayer, and an independent voter. On my own behalf and for the vast majority of those I live and work with, I thank the council and the city for this opportunity to speak. And I urge the Lincoln City Council to maintain the pandemic emergency declaration for at least several more months. I urge this action in order for Lincoln to remain eligible for disaster relief, at least until we have had our chance for widespread vaccination to occur. I base this recommendation on my understanding of robust scientific evidence validating the danger of SARS-CoV-2 COVID-19 novel coronavirus, on the effectiveness of our surgical and 2-layer cloth masks, and of our available vaccines. I also base it on my professional and personal experiences and observation, illustrating the unacceptable and ongoing risk of harm to unvaccinated elders and at-risk patients especially. At least 9 of my patients these past 12 months have died, including a Nebraskan in their 30s and several others ages 50s to 90s, who included the parent of an elementary school student who had no comorbid conditions. Most of my patients survived, but several suffered blood clots, isolation from families, lengthy recuperations, and lasting lung damage. With amazing efforts from our community, Bryan administration, technicians, the custodians, therapists, nurses, other physicians, clergy, families, and the patients themselves, I was able to discharge several patients home even after they spent time on ventilators. I discharged a patient earlier this month who was on the verge of needing a ventilator. Those hospital patients who survived included patients ranging in age from their 20s to their 90s. 2 of my fellow physicians, residents from as far away as Kansas, Iowa, and North Platte, who all looked to Lincoln as a safe place where they could be treated. And I even took care of a fellow parishioner from my church. I believe all of them would support the council and indeed all of our elected leaders and government employees in taking any reasonable action necessary to obtain emergency funds and to spare fellow Lincolnites from the fear and the fates that they suffered. I believe an emergency declaration poses minimal costs and impositions on most of our businesses and our economy, and that likewise mask usage, social distancing, hand hygiene, and vaccination pose little harm to most of us for enormous collective and per individual benefit. Perhaps most crucially, I believe emergency measures are needed for the decreasingly likely but realistic possibility, as mentioned by Dr. Smith and Joan Anderson on his behalf, that the healthcare system could still be overwhelmed with a spike in cases of more aggressive strains, like is happening in Italy right now, despite the fact that they've vaccinated 4 million of their citizens already. I have concern that we could have a situation similar to November or worse when our health system here in Lincoln capacity was challenged. The pandemic is like a campfire that's died down and shows no obvious glowing embers, but could flare up at any moment. I'm well aware that many fellow Lincolnites dispute the human cost of the pandemic and what government's appropriate response should be. I don't relish wearing a mask or urging the public to take these actions. I have social contacts, high school classmates, friends, and even family members who, despite my advice and my experience, they don't want vaccination, distancing, or mask usage in their lives. I think these people have more trouble than I do imagining how they could unwittingly transmit the virus in a human chain to somebody's parent or grandparent and cause the death of that person. While all of us have strong freedoms in our social and political system, I believe the most vulnerable among us should have freedom, that their health and indeed their very lives should not be compromised due to the choices and actions of others. Our community and society have regrettably shown in these last 12 months that not enough of us will make the right choice on our own. Thus, I strongly support not only the declaration but the directed health measures. Please honor the sacrifices of your fellow Nebraskans and the safety of those who remain by supporting maintenance of the emergency declaration for the coming months and by choosing and promoting mask usage, social distancing, hand hygiene, and vaccination. I thank you again.
Thank you.
Up next is Sean Truck. After that, Mary Hamilton.
Good afternoon. My name is Sean Truckee. And I just want us to consider a question today, and that is, how long will Lincoln continue to live in tyranny? Is that too strong a word for where we are at? Sure, we are not a police state like the former free countries of Canada, New Zealand, and the UK, or certainly not as bad as New York, California, or Michigan. But make no mistake, what Lincoln has experienced this past year is tyranny. Webster's dictionary defines tyranny as a government in which a single ruler is vested with absolute power. And dictionary.com states it is the arbitrary and unrestrained exercise of power. Isn't that exactly what we have experienced in regard to COVID over this last year? Now, I understand that there's been some discussion even today about the difference between the emergency declaration and the health mandates. But what I find interesting is that in other cities like Omaha, perhaps Sioux Falls, why is it that their city council voted themselves on many of these issues, like mask mandates? What happened in Lincoln is we have the health department that is dictating everything, and I don't see that happening in other cities. The council is voting on these topics. Citizens are providing feedback on these topics. So I just question that the comments that came up earlier that the city council has no role whatsoever in this, and that the only thing that can be done is for the state to sue the city or the county to change it. I have a hard time believing that is the limit of your role. So I do think these restrictions and mandates that have plagued our citizens and businesses for far too long must be rolled back by this council. I believe that there is authority to do that. I believe people are tired of living under this oppressive regime and are tired of being treated like children. Everywhere we go, we see signage telling us to mask up, keep your distance, stand here, don't sit there, wash your hands, obey, comply. It is just really all insulting to our citizens. And perhaps some of you remember the famous quote that the most terrifying words in the English language are, "I'm from the government and I'm here to help." We are living that out in real time. Over the last year, we have been told it's just a mask, it's just 6 feet, it's just another 2 weeks, it's just another few weeks, another month, another season, another holiday, another year, another birthday, another wedding, another graduation, another milestone, another concert, another business, until there's a vaccine, until everyone's vaccinated, until there's a vaccine for new strains, etc. When does it end? The health department refuses to give any timelines whatsoever, and I didn't hear any timelines today either. All the while, restrictions and mask mandates are actually being lifted all across our country at an increasing pace. I've recently visited other states and areas of our own state that have essentially returned to normal. What a breath of fresh air, literally, to be somewhere that treats its citizens with respect and lets them make their own mind up on how best to protect themselves and their families. Why is that so hard to do here? I firmly believe that our collective response to this pandemic has done far more lasting damage than we can possibly imagine and has had a worse impact than the virus itself. Countless businesses have been destroyed already, and others are on the edge of collapse. The constant fear-mongering has many citizens still terrified to come out of their homes. Children, while mostly in school, have still not had anything even approaching a normal year. They have needlessly been denied so many experiences and normal learning opportunities, not to mention the fact that, frankly, I believe that it is emotional, mental, and physical child abuse that we have kept kids in masks this whole time, even during PE and outdoor recess. At the university level, and in conjunction with our local health department, whole fields of studies are being decimated by the restrictions put in place. The educational excellence, morale, and motivation of students is at rock bottom levels now. I hope to have some students speak to you in upcoming meetings to tell you their stories. The treatment of these students in many cases is just deplorable, and all this nonsense because of a 0.5% positivity rate among UNL students and faculty. As I close, I want to leave you with one question. Will the City Council be content to manage the decline of Lincoln and all our great businesses, institutions, and communities, or will you be courageous and do everything in your power to see it return to normal? The longer this goes on, the harder it will be to justify all these destructive measures be kept in place. The time is now. No more excuses. Please put aside what appears to be obvious politics and do what is right. Thank you for your time today.
You bet. Thank you.
Up next is Mary Hamilton. After that, Van Sean Blythe.
Hi, I'm Mary Hamilton. I've been here before. And just speaking for the hundreds of Lincoln citizens who are angry, frustrated, disheartened by the decisions of the council. Like the guy said, you know, I hear that a lot. Be safe, be safe. What is safe? You know, I'm a Christian woman, and the Bible says, but the Lord is faithful, and he will strengthen you and protect you. And I think that being safe to me is making, you know, common sense decisions. This emergency declaration is now unnecessary because it was only authorized for 72 hours. It has been directed to continue for a year without any debate or input from the public. And, you know, I just don't understand what's going on here. And I like some of the talk that about when is it going to end? You know, you asked some very good questions, Roy. That was an excellent question about when is it going to end. As far as I've seen, and I've been looking and looking and looking, and there are no correlations whatsoever to all of this mask wearing, all of this stuff that's been going on. It creates a dangerous concentration of power to the executive branch with no checks and balances from the legislative branch. The city council members. It raises serious constitutional problems. We have been held hostage by city officials holding FEMA funding at a higher regard than personal freedom of the electorate. The Emergency Act could be defined by only allowing an emergency declaration in a situation where emergency actually exists, defined by some sudden crisis that cannot be addressed safely or swiftly enough through ordinary political processes. I know that tonight that was interesting that we discussed earlier about the flood and how the emergency was still in place. I'm not really against that part of it. I just really am confused as to all these experts that have been allowed to present. Many times I've heard the term follow the science, but science requires many points of view rigorously tested and challenge to arrive at any type of conclusion. A science of politically correct groupthink is worthless and not real science at all. That means elected or appointed officials should abdicate their responsibilities to experts. Experts disagree, as they should. If a mayor can declare an emergency and tap a vast range of special emergency powers, including funding of special pet projects or people or groups that are part of her political agenda, then she is abusing that executive power. It is your job to hold the chief executive in check so that this doesn't happen. You have not shown the public your willingness to hold this mayor accountable. At this point in time, there is nothing that the ordinary legislative processes cannot address. Our hospitals are not overwhelmed, our numbers are on the decline, and our governor has given us the green light to return to our lives. I have another question to propose. Why was it that when we had H1N1, SARS, MERS, and other viruses that were just as deadly, probably just as much deadly, and I know that I had one of them, so I'm just wondering why not the mask then? Why the mask now? And I'm not exactly against the mask. I'm really more against what it is doing as far as holding us hostage, like I said. We need our freedom, and we want to get it back now. Thank you.
Okay, thank you.
Up next, Fanshawn Blythe. After that, Candy Turner.
Fanshawn Blythe, I just want to thank the medical people for being out there. A lot of them are my friends, but I would tell them to follow the COVID money. I'm here to talk about the emergency declaration as a result of COVID. You know, now that we can say the words emergency and declaration together in the same sentence in this room, many people will weigh in today on whether the stats merit us being in an emergency or not, with the dial being in mid-yellow. They will weigh in with many options and opinions. They will weigh in with stories from their experiences, like the two doctors did last week. No moral compass is what Dr. Rice called those who differed in opinion from him. Aside from all the opinions, let's talk first about a few of the mayor's motivations, and secondly, why some of you may want to continue this state of emergency. Let's start with the funding of $500,000 from unspent community development block grants, which comes from the City CARES Act money. According to an article in the Lincoln Journal-Star, and I brought it, $500,000 was donated to the Lincoln Little Fund. What is Lincoln Littles? I decided to spend a little time on their website and discovered that they are a small subsidiary of the Lincoln Community Foundation. Lincoln Littles is, quote, network of advocates. Lincoln Little raises opportunities for all children, helping them gain access to quality care and education, ensuring they are ready for school and life of learning, end of quote. So that sounds really great, right? Except I scrolled further down and looked at the list of, quote, early childhood champions team, end quote, and I found three pretty huge conflicts of interest when I looked at their website. First, I found two of the tri-chairs very interesting. One of them is Councilwoman Tammy Ward, and the other is Liz Ring Carlson. She is a family friend of the mayor as far back as I see as 2009, and she is married to Justin Carlson, the mayor's campaign treasurer and the spokesperson for Decline to Sign. And once you get past the tri-chairs, there are a few other interesting names, like Adele Burke and Kate Bolts, who both currently work as aides for the mayor and are on the board of Lincoln Littles. The Lincoln Community Foundation's website states that their vision is to nurture, harness, and direct the energy of the Lincoln community, and for those who can provide financial resources needed to accomplish these great things. The foundation seeks to be a valuable facilitator, so that sounds really great too, right? Except I dug even deeper to find who was on the board of the Lincoln Community Foundation. I see plenty of buddies of the mayor. Jay Wilkinson from Fire Spring, who contracts with the city for printing. Mickey Esposito, the mayor's new pick for heading up the version of the Green New Deal. Dan Marvin, who was the first of the mayor's appointed staff, and current councilwoman Sandra Washington. And last but certainly not least, the mayor of Lincoln is on the board of the Lincoln Community Foundation. Is this not a conflict of interest? No doubt, Lincoln Littles and the Lincoln Community Foundation do amazing things and are vital to our community, but you simply cannot dismiss the fact that they are both saturated with those who are involved with the mayor. Some of the organizations that have already received these funds are amazing, and they do great things in Lincoln as well. The mayor should not be allowed to prioritize funds for charities because of conflict of interest for her and her buddy club. We, the people, deserve better, and you should be the ones to give us a voice. End the emergency declaration and do your job. After a year, our government needs to go back to how it was meant to be run and not how it is running now under this emergency declaration. And one thing I'm going to add while I sat here, that hearing Mr. Marvin, that we are still helping folks out with rent. Boy, that $500,000 sure could have gone to help a lot of Lincoln residents who are still in need. Thank you.
Thank you. Next, we will probably take a break at 5 o'clock for 5 minutes.
Up next is Candy Turner. After that, Renuga Vivekanandan.
And then we'll take a break.
Hello again. I'm very happy to see that this resolution is finally being addressed by the City Council. I think it's a shame that it's taken 364 days to do so. I believe it's time to end the emergency declaration and begin the process of recovery. Back in 2020 of March, the American people were inundated with posts, tweets, videos, news reports, COVID. Within 5 weeks of the WHO declaring a pandemic, there were over 1 billion mentions of COVID-19 on both social and mainstream media. Those mentions of COVID, just that term COVID-19, generated over 3.9 trillion impressions. That's a whole lot of people seeing that in their news feeds. We saw videos of people dropping dead in the streets of China, hospitals cramming people together and claiming there were no beds or ventilators to be found. Citizens in other countries were being welded inside their homes in forced quarantines. This was a true emergency if ever there was one, right? People were dropping dead instantly, it seemed. So a state of emergency was declared in Lincoln before we ever even had a case. Meanwhile, we are being fed a steady diet of fear porn from every media outlet and social media site. Fear of the unknown dominated all of our decisions. Better lock it down and douse everything in sanitizer just to be safe. With the passing of the Communicable Disease Act of 2007, there were quite a few changes made to the Lincoln Municipal Code, which was referenced earlier. This was because of a different super scary virus that was going around. That was H5N1. I don't know if you remember that one. There are so many viruses that have been touted as humanity enders in the last 25 years, so it's pretty easy to lose track of those. Anywho, those changes to the code gave massive power to the person who held the position of health director. The power to issue DHMs, board up businesses at will, and forcibly confine private citizens to their homes. Not one of those powers are dependent upon a declaration of an emergency by the mayor. Probably why there was such a stink over the position being filled by someone other than a physician or an epidemiologist. We are hearing a lot of testimony today with a ton more fear-mongering by people who are obviously falsely under the impression that lifting the emergency declaration gets rid of the DHMs. They don't. You could end the emergency declaration today, and the DHMs don't disappear. People can still choose to wear a mask. We can still take safe measures to protect our vulnerable. That's not going to change. Lincoln's already received millions in relief funding. Distribution continues, and the distribution of those funds is at the whim of the mayor. Again, a power which does not need a declaration of emergency. State of Nebraska itself has received over $1 billion in funds to date, which they are yet to distribute all of that through grants. How much longer are we going to make ourselves the victims in this story? So with the questions of relief funding and the DHMs out of the way, why exactly are we pretending like we are in the same situation we were in 364 days ago? In my opinion, this is a giant farce. This does not meet the definition of an emergency. None of the day-to-day actions that you are performing indicate that this is an actual emergency situation. People who truly believe this is a state of an emergency and are worried about super contagious viruses don't just hop on planes and visit COVID hotspots in California during December and then not quarantine before presiding at council meetings. People who are worried about viruses do not trust their lives to cloth masks, which are as effective against nanometer-sized viruses as a chain link fence is against a mosquito. We don't even have a shortage of hospital beds now or dead piling up in the streets. We have TikTok nurses. As citizens, we were pretty much unanimously agreed to the terms of 2 weeks to slow the spread. Seemed reasonable, we could all take a little break and do our part, but things quickly became unreasonable. We will never be completely out of danger by infection from viruses or bacteria. Best we can do is encourage people to be healthy and take common sense measures to protect the vulnerable. As citizens, what we did not agree to was unending government overreach. We did not agree to those in power using emergency declarations and health mandates to restrict the activities and movement of healthy, law-abiding citizens while allowing crime rates, drug use, domestic assaults, and suicides to skyrocket. If you're looking for a true emergency, look no further than the vacant positions of the Lincoln Police Chief and Lincoln Fire Chief. Thank you.
Thank you. We'll have one more and then we'll take a break. Is that okay?
Up next is Renuja Vivekanandan.
Good afternoon. Thank you for letting me the opportunity to speak to you all. Oh, sorry. I'm an infectious disease physician in Omaha, Lincoln area. I help patients across Nebraska. I'm also an associate professor in a higher ed university in infectious disease, and I also have background in hospital epidemiology. So if you have any questions, I'm happy to answer. You know, one of the things I've learned during this pandemic has been not I, but we. How do we all protect each other? And one of the focuses I wanted to take today is about the UK variant and the other variants that are in our community. So currently, over all the states are experiencing the UK variant. In Nebraska, we have had about 8 cases so far. So we're slowly seeing little by little some cases. What you can expect is, if you do not have the emergency declaration and mask requirements, these cases will slowly doubling time for the viruses. In Italy, like my prior colleagues have talked about, currently they're going into restrictions. In UK, if you go back and look at back in December, they started noticing this variant about middle of December. By middle of January, they had increased amount of cases and a surge. I know in Nebraska, we have done a fantastic job. In November, December, when we had the surge, we all wore our masks. We all did social distancing, hand hygiene, and we have done a really good job bringing down the cases. But the pandemic is not over yet. We just need a little bit more time. We need to vaccinate at least 80 to 85% of our population in order for us to get herd immunity. If we are able to get herd immunity, then yes, we could start relaxing some of these mandates. But for now, it's really important to continue these tools that we have. Vaccine is one tool, but wearing a mask, social distancing, and hand hygiene is another tool. And as a mom, I have 2 little kids who go to school, and they go to school, they wear a mask, and they've been very healthy thus far. One thing that is very important to know about the UK variant is that it's 50% more contagious, and it also affects young adults and children. So in order for us to stop the spread, we have to continue to wear masking and social distancing. And I'm a fan of things will get better. We're doing an amazing job in Nebraska. If you look at the vaccine rates, 14.4% of our population is vaccinated currently on DHH's website. We will get there. By May 1st, there's more vaccines that are going to be available. We will even get faster to that goal of 80 to 85%. But until then, we just need a little bit more time to continue with these mandates. Thank you.
Thank you. Okay, it's coming up on top of the hour. We'll take a 5-minute, 7-minute break. We'll start again at 5:05. Okay? Thank you. I'd like to call the meeting back to order for March 15th, 2021. And we're in the process of doing public hearing on item 4E, correct? Okay.
Now we have Jane Kinsey. After that, Sean Hansen.
Jane Kinsey with Watchdogs. Let's face it, this whole thing, this whole country is political. All of the palaver that we hear about science, about health, etc., and that we've heard today is nothing but politics. Take a lesson. The CDC just announced that they are lowering the restrictions. And what happens? But the president gets on television Thursday night and he says, well, by 4th of July, you may be able to have some family gatherings in the open air in your backyard. Fauci himself, he comes out a year ago and he says, oh, masks aren't going to mean a thing. They might make you feel better, but they're not going to do a thing. Now he's talking about 2 of them on a person. And the mayor has, and the governor have also both entered into this. The governor says one thing for the state, and the mayor has to make her power move for the city. Of course, the Pat Lopez is just her puppet. She can't do anything on her own. So here we are. The whole thing's a joke. Did you see on the front page of the Lincoln Journal-Star all the people downtown mingling together with no masks or social distancing? So it's really a point of what you do is not going to really make much difference. So I am going to speak to the mental health. As a licensed mental health professional, the mental health of people who are locked up, who cannot go to school, who cannot work, and who have to wear masks is not something to be ignored. So the physical health is as important as the mental health. And we're going to have a lot of problem, if we don't have it already, with people who have been ordered by the government to do what they say, whether it makes sense or not. I want to tell you the power play that the governor or that the mayor has made. There's an organization in town called the Friendship Force. It is a worldwide organization formed under Jimmy Carter with the headquarters in Atlanta. And the purpose of it is to provide peace among people and to have a person-to-person contact. So the Friendship Force had a virtual Zoom meeting with some people from Russia a few months ago who were supposed to come here and could not. And she was to speak to the issue of journalism for a few moments. So what did she do? She starts telling them about her great efforts to manage the COVID in Lincoln, Nebraska, and she went 10 minutes over the time. So this is all boils down to politics, and you need to consider a different kind of vote, not just for your politics. We have a election coming up, people will be looking at the politics and at your vote.
Thank you.
Up next is Sean Hansen. After that, Matt Maslonka.
Good afternoon. My name is Dr. Sean Hansen, and I am a hospital medicine physician at St. Elizabeth CHI Health. I'm here today representing the Lancaster County Medical Society. I would like to thank you for allowing all of us to come and speak to you today regarding the emergency declaration and somewhat on the directed health measures. I have taken care of the COVID patients in the hospital setting since the beginning of this pandemic. They range in age from the early 20s to the very late 90s. I've seen firsthand the destruction that this terrible disease process has caused. A year of unimaginable heartbreak seems like not even enough to say that statement. Families who have lost both their mother and their father, both their grandparents, their spouses, a child. My colleagues and I have seen this every single day, and not only the losses, but the ongoing perpetual grief that families have suffered, that the citizens here have brought to you. Patients who have continued have medical issues from the COVID-19 infection long after their discharge from the hospital, the so-called long haulers. Though we have seen a recent decrease in cases and hospitalizations, we cannot let our guard down in what may turn out to be a very important turning point in this pandemic. On CNN yesterday, Dr. Fauci, the director of the National Institute of Allergy and Infectious Disease, commented on this statement. And he said, when you see a plateau at a level as high as 60,000 cases a day, that is a very vulnerable time to have a surge, to go back up. And that's exactly what's happening in Europe. The younger people particularly stopped wearing masks. All of a sudden, you have a surge that went right back up. As you may know, we are now seeing variant strains of the SARS-CoV-2 in the United States. And as my colleague brought up to you just recently, she's very concerned about the UK variant. Some of these variants have been shown to be more infectious and even cause more serious illness than we have seen before. We have the tools such as masking and social distancing, limiting crowd sizes, and I urge you to continue with the emergency declaration and these mandates. In closing, I would encourage every adult that is able to get vaccinated so that we can help our community end this pandemic. Thank you for your time.
Thank you for coming down.
Up next is Matt Maslonka. After that, Janet Rice.
Hello. Matt Maslonka, 1500 South 48th Street. I'm a pulmonary and critical care physician in the Lincoln area and have seen firsthand the effects that this pandemic has not only affected healthcare providers and the healthcare community, but the community as a whole. And as we sit yet again at another watershed moment in this pandemic's history, this past year has taught us a lot about this virus and how our response to it can work and how it cannot work. We know vaccines work. We know that social distancing works. And even more than from a logistical standpoint, we know that the emergency declaration has worked. It took too much effort to get to the current state that we're in, and it does give us hope for the future. But hope without action can yield regret. The stakes are too high to take risks, especially when we have a successful path forward. No one wants to look back and know that just a little bit more patience could have saved the lives of more Nebraskans. I can understand how some might say our mentality is a little too cautious, and I assure you that those people haven't watched the heartbreaking moments as family members say goodbye to their loved ones through a screen on a device. But we have, and because we have, it's our duty to be a voice for those we've lost and to prevent further families from having to go through that same sorrow. So I do want to give a glimpse into what healthcare providers have been seeing. During one of my busiest months we had this winter, I walked into an 89-year-old patient's room who was on heated high-flow oxygen, one of our last measures before we have to put onto a ventilator. As I opened the door, I immediately noticed that on the wall, almost completely covering the entire wallpaper, were taped handwritten notes. Some said, and stood out, "We love you, Grandpa. Fight, fight, fight. Stay strong, Dad. We miss you. You can do this, honey. All the kids are praying for you to get well," along with a dozen or so crayon drawings of stick figures and hearts. When I first saw this, it made me smile, because now, rarely do we get to see this degree of social support for our patients. We know how critical that it is for someone who is constantly battling in the hospital to heal and get better. However, when I walked further into the room and saw the patient sitting up in the bed, gasping for air and visibly defeated, it was clear to me that even his wall of support from those closest to him in this world were not enough to cheer him up. And during those busy times, I would only have typically a few moments to do my assessment and ask the patient a limited number of questions about their symptoms to formulate a plan and talk to other nurses and healthcare providers. But this patient looked so notably depressed that I sat down and took time to talk with him and ask him about his wall of love. He responded to me with flat one-word answers. And as I pointed out the pictures his great-grandchildren drew for him, I knew he was ready to give up. I told him what our plan was for the day and how important it was for him to work with a physical therapist and attempt to get out of bed to the chair, if only for a few moments. He shook his head and said he didn't want to see them that day. I understood, and I left the room while he stared blankly at that wall. Throughout the rest of the day, and all of the other patients I saw who were in the same place, physically and emotionally exhausted to a degree that few can ever imagine, I kept thinking of this patient and how hard it must be for his family to have their patriarch go through something like this leading up to a holiday. It was about Thanksgiving at that time, where we should all be surrounded by our family and the warmth that their love brings. He died the very next day, after telling his nurse he wanted to stop all treatment. And it's stories like this that should touch even the most skeptical ones of us, because if we took just a little bit more care, we could potentially save a family from having to feel that pain of losing a loved one to a preventable disease, and allow grandkids to be able to spend another holiday with their grandpa sitting in his lap instead of him sitting there staring blankly at that wall. We have the power to do that, and measures like this emergency declaration preserves that ability. The vaccine is our way out of this whole mess. We know it's coming to more and more Nebraskans each week, and until we can get to at least 70 to 80%, it would be hazardous to waste the progress that we've made to get to this point, which is, I believe, the answer to the previous question about where the finish line is. It's getting to that threshold of herd immunity, and that is the end point. Thank you for your consideration and listening and trusting the healthcare providers, and I hope together that we can all finish strong.
Thank you.
Up next is Janet Rice. After that, Richard Lorenzen.
Good evening, City Council members. I always get so nervous when I come up here and speak because I'm not used to speaking publicly. The last 2 weeks when I was here on the 22nd, Jane Raybould, I was so appalled, even though that I was here, I couldn't even put into words how I wanted to say to you the point of order, and wanting to close the meeting early was really upsetting to me. And I've watched many city council meetings, not just here in Lincoln, Nebraska, but when we lived in Michigan, because my teacher was mayor, he was also a city council person, and I've never seen the city council members act like that. And Richard McGinnis, to hear you whisper and think that anybody didn't hear you, you were wrong when you said, I wish I could have got that gavel down fast enough. That I wanted to be here last week, but I couldn't because I had to take care of my son, who has autism, as I have shared with you once before. And my son has watched the city council meeting and is watching this evening. I'm trying to find my notes, sorry. But I'm going to move on from that. So the first thing I want to address is the behavior, sorry, I already discussed that. The mayor has 72 hours in the city charter rules, and there has been no questioning of where we are going with this, and it's been 364 days. Tomorrow will be 365 days. I know that so many have already shared that. But we need to hold our mayor accountable, as that's what we've elected you to do. And we haven't seen that transparency with the city council holding the powers that you have for the checks and balances. I recognize that City Councilwoman Sandra Washington, there was the concern of the emergency funding and what would that look like if we let go of the emergency declaration, and if we didn't continue with that, are we going to lose the funding for our city? And I know that Governor Ricketts has ended the emergency declaration for our state, and I know that, you know, as I had to do my digging and do my homework, that we can go back to you can have that money available. You just have to go to the governor if we end these. And yes, I recognize that the coronavirus is a virus. I had 2 family members recently that one has passed away and the other one lived. And they took all of the necessary precautions. They lived in their home. They were not able to go out and go grocery shopping. So they had people that would come in. They wore their mask when they were in their home. They themselves wore masks. They wore gloves. The home health aides would go and do their grocery shopping and meet their needs, but yet they also contracted this coronavirus, even though that they were masked up in their own home. The caregivers that come into their home were masked up. It's a virus as any other virus. I also used to be in the home health. I was a home health aide for hospice. I also worked in nursing homes. I have a father-in-law who is in a memory care facility I have seen him decline rapidly. He's only been in a facility for 2 years. I worked with dementia patients for a long number of years. And yes, you do need to do the science. But when you look at the vaccine that is out, to be part of a vaccine, you have to have the live virus in the vaccine for it to be considered a vaccine. This is not a vaccine. This has been only in the market for not even a whole year. And it concerns me. And even to hear Robin, I forget her last name, forgive me, but she's on the morning show of Good Morning America, and she had concerns of her coworker, who the coworker's wife is expecting, and she says, "Aren't you concerned that your wife got the vaccine because the wife is expecting?" And 7 months.
Time's up.
Thank you.
Thank you.
Up next is Richard Lorenzen. After that, Judy King.
My name's Richard Lorenzen, 951 North 56th Street here in Lincoln. We the people, government of, by, and for the people. It's not people run by government. Dangers, having children's dangerous, can be a lot of joy, a lot of dangers. Scuba diving, dangerous. Flying in airplanes, riding on cruise ships, dangerous. Driving cars, head-on collision, dangerous. the state issues a driver's license that permits me to drive a 2-ton vehicle on a highway with maybe 10 feet distance between opposing traffic. And the state patrol is out there watching me do it. Life, liberty, and pursuit of happiness. I'll decide my life and my liberty and my pursuit of happiness. The virus is important. There's other things more important. It's the Constitution.
Amen.
Thank you for your time.
Thank you.
Up next is Judy King. After that, Britt Holtmeyer.
Haven't done this for a while, so is there this one?
Either one.
Okay. Judy King, Judyking. And I haven't been here for a while, but I wanted to say, I can't believe what you all have been through with these people specifically. No maskers. I can't believe what you've had to tolerate, their behavior from them. And I applaud you, and I thank all of you for doing what you've been doing, putting up with this guff for I don't know how long. And that's just the first thing I want to say. Just listening to them, they're talking about tyranny, and the only tyranny is that I'm sitting here at 69. I have to worry about them getting too close to me because they're not wearing their masks. And the tyranny is they can kill me just by breathing on me, and they're the pansies that can't even put a freaking mask on. They're a bunch of crybabies, and they're turning this into a situation of it's their freedom? Give me a break. All they got to do is put a mask on and walk around with the mask on, you big babies. I have, my granddaughter was living with me before this COVID started. And when it started, she moved out to get a place of her own so that she wouldn't bring home COVID to us. My husband's a lot older than I am. And so here she is moving out. She'd saved some money to get by, works at a restaurant, and she caught COVID. And she's a frontline person. She needs to work, to pay her rent now. And they're managing to keep that restaurant open, but if the emergency declaration is taken away, my granddaughter gets it again, you may have to look out because you're going to see a little old gray-haired lady coming after you, whoever decides to take that away. The governor can't even seem to get the meat packing plant workers vaccinated. They're the ones that are on the front line feeding us every day, and he can't seem to get enough vaccine to get them vaccinated or to give them medical leave or pay. So I mean, I'm so proud of the mayor for doing what she's doing, and all of you for standing behind it. It's meant the world to me, and it's meant the world to a lot of people my age who have been stifled for a year, staying inside, trying to keep away from people like this back here that don't wear masks. So I love all of you that have been fighting for this, and I'm going to vote for you and back you. And like I said, the only tyranny are these people here that are too pansy to wear a mask. Thank you.
Thank you. Next.
Britt Holtmeyer. After that, Gretchen Hess. No. Gretchen,
No Brett? Okay.
Gretchen Hess.
Yeah. Why don't you come up, Gretchen?
After that, we'll have Stephanie Johnson.
Hello, I'm Gretchen Hess, Lincoln, Nebraska. I do want to address what I just heard. I don't think that we need to name call and talk about other people's business and who can wear a mask and who can't wear a mask. It doesn't serve any purpose. It's not helpful to anybody or any situation. It's only hurtful, and it only continues the divide. So it's really not helpful, I guess is what I want to say. So a year ago now, we were faced with what was described as an emergency. The definition of an emergency is a sudden, usually unexpected occasion requiring immediate action. Last week, a member of my family found themselves in the emergency room. We went there and were evaluated, and during the visit, the physician worked together with us to come up with a plan of action, and then just like that, the emergency was over. That's how emergencies are. They occur suddenly, and then the occasion requiring immediate action is over, therefore effectively ending that emergency. After the initial treatment, we were dismissed and followed up with our primary physician as scheduled. Can someone tell me why after 364 days, we are still in this state of emergency? If we went and stayed in the ER for 364 days, besides racking up a horribly expensive bill, we would wonder why we were still there. My question is, what are the conditions needed to, what conditions are needed to, or need to occur to end this emergency declaration? Can anyone give us the answers? Just a little more time is always the answer that I hear, or herd immunity, as the doctor before me just said. The end goal is always changing. It's always moving. So why in the world would each of you hand over, back last year, your essential part in this city government? I'm not understanding. Why have you given up the checks and balances and the important oversight? You're the eyes and ears of our community. The overreach that has been shown by her, the mayor and the health director, is concerning. We should be focusing equally on reversing the damage done to our economy while balancing health and safety. This lack of leadership and desire to work together speaks volumes. Is this the direction you want for our city, or is this the type of leadership okay? A year ago, when we were forced to stay home, I discovered something interesting. I discovered a TED Talk someone gave about momentum in a particular city. The city then was experiencing a period of remarkable progress. It would make top 10 lists nationally, and how that was tempting to assume that momentum was to be expected. But then the speaker shared just how intentional that momentum truly was. They had made meaningful, deliberate, and thoughtful choices that ignited that momentum and gave it purposeful direction. It was shared how cities gain momentum when citizens unite around a shared goal or priority and work together as one. Strong partnerships between business leaders, citizens, and a supportive city hall and committed citizens together played a key role. This was a huge undertaking and required the leaders to learn how other cities were doing such projects. Hundreds of town hall meetings were held where they encouraged people to ask questions. This kind of deliberate effort on their part meant that momentum for the project grew. More and more people began to unite around one vision. This collaboration was crucial to the civic progress. The individual giving this talk shared that one of the most important things she did in her role of public servant was to hit her mute button and listen. You know how I like when we listen. One part told how there was a project that the speaker really wanted to jump on to propel the city forward. This project was dynamic and she wanted it badly, but City Hall listened to the community and what they heard was different than what they thought they needed. Ultimately, they developed a new plan that benefited the city even more than they'd ever thought possible. Isn't that extraordinary? When they listened to many different people, their initial plan changed? The changes to the original plan seemed at the moment like the opposite of momentum. However, they realized it was their ability to hit their mute buttons that kept the city moving forward. The speaker also talked about challenges. It was stated that challenges in a community often mean that all the individuals will make sacrifices for the greater good. But I'm not seeing all individuals making the same sacrifices here in our city. That's where the disconnect comes in. That's why you have two very polarizing views. Some people are hurting and some aren't. Did you give up your paychecks? Many of your constituents did. Now, for those of you who don't know what that city was or who gave that speech, it was given by our current mayor when she sat on this very board and was describing our city. After listening to that, I wondered how her views had just changed in a few short years. One has to wonder if it comes from not having those checks and balances in place. How quickly she forgot that all of this once she found herself in the leadership position of our city. Our momentum here in Lincoln is a result of all of us. The work you do here, or us citizens or business owners do, are crucial to our city's success on all fronts. As Mayor Baird asked, what will each of you do to keep this momentum alive? Right now, as you know, things are bad. Our economy is bad. Businesses are closing. Mental health is at a critical point. And there isn't a day that goes by that I don't hear of a suicide or been personally affected by one. Are you asking those difficult questions? Hyper-focusing in one area is never good. Working together is essential. Closing chambers and preventing people from coming together to work toward one main goal is never positive. Not allowing input is not good. I'll leave you with this. Mayor Baird finished her talk out by asking everyone to think of our community. What's the one thing you'd like to preserve or address or improve? She said. Whatever comes to mind, you need to harness that momentum because we know that it isn't inevitable anymore. In her words, it's up to all of us to work together so that we may continue to propel Lincoln forward deliberately, meaningfully, and purposely to our bright and shared future. Thank you for your time. Taking back your control and ending this emergency declaration is imperative to our future and our children's future. Thank you.
Thank you.
Up next is Stephanie Johnson. After that, Jennifer Amend.
Hello, my name's Stephanie Johnson. I'm a wife and a mom and soon to be a grandmother. Drove down here just very spur of the moment. Didn't have any plans to come down today and actually haven't been involved much in watching a lot of your meetings, but through the blessing of COVID have really been, it's been such an eye-opening, it's just been so eye-opening. My husband and I talk about this. We cannot believe that all these years we've had our head down. We've been working so hard, raising our children. We're both professionals in the community, and trusting our government, putting all of our trust in you. COVID happens, and it's like we've woken up to realize this is what we have now. It's so heartbreaking to see what's happened to our government. One of the things that's interesting is that we're here to discuss the emergency order. It's an overreach of power, right? The thing of it is we all were born free. I want you to think about your jobs for a second as I've had to think about mine, and just put this thought inside your heart and your spirit, is to know and to recognize we were all free when we were born. You didn't give us that right. Nobody gave you that right. Nobody gave me that right. God gave me that right. You were given that right. We elect people in our system of government to protect our God-given rights. So as you make decisions and you look at that emergency order, Jane, as you're writing, thinking, taking notes, I hope that you're taking notes over what I'm speaking about, because I've seen how rudely you've treated people. It's been so heartbreaking for me to watch. I can't tell you how heartbreaking that was to watch a couple weeks ago. I'm like shaking thinking about it. If I acted like that as a teacher, as a speech pathologist, as a business owner, oh my gosh, I would have lost the respect of every single employee, and that's what's happened in Lincoln, Nebraska. I want you to know that. But anyway, woke up, and this is what's going on. I was born with freedom. You were born with freedom. I want you to think about when you make decisions about this emergency order that really clearly oversteps the boundaries of control that our government has over us, is that you and your job, what you were elected to do, was to protect my freedom, the freedom I was born with. You're not in a position to think about what takes my freedom away. You are in a position to think about what protects my freedom. That's your job. And if you make decisions on what's keeping me safe and do not believe that I or anybody else has the authority, the God-given authority to make our own decisions on our own health, you're wrong. Completely wrong, and you know that. You can make your own decisions based on your health, and I can make my own decisions on mine. With all due respect to the doctors out in the hallway, which I thoroughly respect, they have not given one clear piece of data toward their argument. It's all anecdotal observation and heartfelt thought. The only clear evidence I've seen brought before you have been people that have wanted you to stand up for our liberty and our freedom, and they've been trying to show you facts, trying to show you facts. Now, they might come in, since I said that, with some facts. They might, but they haven't yet. I've been taking notes. I've been watching very diligently. The way you have handled yourself is so embarrassing to the fact that we've awoken to this. And you've awoken a sleeping giant, my friends. You have awoken moms like me who know what's going on. I want to end with a quote by Ben Franklin. Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty or safety. God bless you. Thank you.
Thank you. Next.
Next is Jennifer Amend. After that, Jennifer Beals.
Jennifer had to go pick up her daughter. She'll be back though.
Okay. Jennifer Beals.
I can see her coming.
Coming.
I'm Jennifer Beals. I am a hospitalist at Bryan Health. I've been working there for the last 2 years. I'm from North Dakota, but I trained at UNMC in Omaha for my internal medicine residency. So I only work in the hospital with adults 18 and over, and so I have a lot of experience personally with this pandemic. I'm not only a doctor, but I'm also a mom of 4 kids that live in town here, 10 and under. And over the course of this year, my group has treated over 1,200 people at Bryan with COVID. At one point in our surge in November, we had up to 150 patients in our Bryan hospitals that our group was caring for. During the things that I remember the most in this pandemic was, in the beginning, not a lot of people came to the hospital. Everyone was, sheltering in place, and then, as the summer hit, more, and the mask mandate helped things open up. Our numbers started to increase, and then in June 16th, I remember, because that was the day that the study for dexamethasone steroid came out. And definitely we noticed a difference in decreased mortality with that therapeutic, but despite having steroids available, people still die of coronavirus. We do everything we can do to help them, but we can't save everybody. And so we still have people that are dying today. I came directly from Bryan East Hospital today, from the ICU, from a room with someone who was on a ventilator who was positive for COVID. It's still happening now. In the height of it, in November, myself, I took care of about 18 patients a day during a week in November, and all of them were positive. And one thing that we really try hard to do with our group in particular is we try to call families, because if you have coronavirus and you go to the hospital, you need to isolate for longer because you're sicker.
So the CDC guidelines say you need to isolate for 20 days. So for 20 days, you're alone in a room with just nurses, doctors, respiratory therapists, and your family can't come and visit you. We have iPads that we use to have people FaceTime their families, but sometimes they're too sick to use that. They might be on a ventilator, they might have sedation. We still try to do these things. So every day, at the end of the day of seeing all these patients and putting our big pappers on, we have awesome PPE with Bryan Health. And so we put these big pappers on that we use to go in rooms. And after the day is done and we do our notes, we call families. We call every single family and give them an update on how their family member is doing. We still do that today. And, you know, there's been good news that the numbers are decreasing, but our pandemic is not over. This is an emergency state because if we loosen restrictions and we go back to normal, we could easily have a surge again. This happens in many different countries. Some of my colleagues talked about how Italy is locking down again. There's a place in Brazil, there was a recent article about where they opened things up and we surged again. One thing that has been amazing about living in Lincoln and having children is that with these restrictions, my kids went to school all year. They went to daycare all year. I could go work and help people with coronavirus because my kids had places to go. And so I am very pleased with how the vaccines have came out. I got my first vaccine on December 14th, my second vaccine on January 3rd. And we really need to get more people vaccinated because that's how we end a pandemic. We end a pandemic by getting herd immunity from vaccinations. So I really strongly encourage you to continue what you're doing with this emergency. We are in an emergency. We want to continue doing what we're doing to protect as many lives as we can until we get to the end of this pandemic.
Thank you.
Up next is Alina Newman, and after that, Kelly Stage.
Good afternoon, or I guess evening now. I am Dr. Elena Newman. I'm on 5610 Hutz Drive. As you probably noticed from last week, I like to post challenges. And just last week, I present to you another challenge. My unique story, and I will get emotional. This is the Cliff Notes version. I empathize and sympathize with Mr. Gill, because I am too an immigrant. I came to the United States when I was 10 years old. My family is Armenian. We lived in Baku, Azerbaijan. I dare anybody to say that 10 times fast. When I was 4, the country experienced a territorial religious upheaval, much like they did a few months ago. When my family's apartment was broken into and we were given a choice, leave and live or stay and die. May I also mention that most of my assailants wore masks. My family left with nothing but the clothes on our backs. My grandfather had 2 mismatching shoes. We, along with many other families, were loaded into a bus and dropped off at the railroad tracks. That's where we stayed for what seemed like weeks. We then boarded an airplane, dropped off in Moscow, and told to scatter. The families refused to leave the plane until the country gave us a home. They did. A rat-infested, dirty hotel. At that time, my father was working on paperwork to come to the United States. It took him years to get it approved, 5 years. So in 1993, we came to the U.S. I remember our first apartment on South 9th Street. My brother and I thought it was a mansion. We thought the door stoppers, the little boingy ones, were anti-theft devices. We didn't have to worry about hot water limits. In Russia, hot water would run at a certain time. I remember my first phone number. 11 months later, my father died. 11 months is what I remember of my father. So I can say that for a majority of my childhood life, I didn't have a father figure until my mom remarried again. I continued on. I remember going to elementary school. I remember being told that we'd be making and eating dirt cake with worms. I was scared because I expected the worst, like I was conditioned to do since I was a little girl. Little did I know it was actually the chocolate cake with the little gummy worms. I knew zero English. I remember needing a translator, and then she left. We recently recommended. I continued with school and graduated as a salutatorian in 2002. I keep trucking now, working and being a contributing member of this community. I'm trying to do the best I can, just like many people. What's happening is having a huge mental health toll on me and others like me who are too afraid to speak. No one talks about that. Even the mandate has exemptions, but very few acknowledge those. I'm constantly called out in front of others. I was asked to show a doctor's note in the middle of a grocery store. And yes, I have one. I'm called a murderer. I'm called a narcissist. I am bullied on a daily basis. Today in this chamber was one example. You saw Miss King. That's what I'm facing every day. I'm far from any of those names. I'm struggling to balance what I escaped to what I'm currently facing. I, just like many, am trying to exist. Realize that some of us are being forced to experience trauma over and over and over again. Thank you.
Thank you.
Up next is Kelly Stage. And then after that, I'll recall Jennifer Amen to see if she's back.
Thank you for the City Council staying late and hearing everyone out. That is what everyone is supposed to be doing. Nonetheless, I do find this resolution absurd. We are thinking about having gone through a year of this, and that's hard to manage. It's hard to accept. But it hasn't, and nothing has changed. We're getting close to things being somewhere good. We're getting close. But we're Daniel Jones right now, running with the ball 80 yards, and we can choose to fall on our faces and not get a touchdown, or we can choose to continue and do the things that have worked. Last week, two experts from right here in Nebraska, Dr. James Lawler from UNMC, Dr. Bob Browner from Lincoln, explained that the U.S., including Governor Ricketts, and even including President Biden in their opinion, is not doing enough to prevent another surge. In the Omaha World Herald, it was reported that Dr. Lawler was quoted saying, there should be PSAs, public service announcements, blanketing the airwaves. The article went on to state that Lawler, an expert on pandemics and a director of UNMC's Global Center for Health and Security, and Dr. Bob Browner of One Health Nebraska Physicians Group both said it appears that everyone is needs to be more clear about the seriousness of the pandemic. But what's lacking is still a, quote, all-out public relations effort to urge Americans to wear masks and take other precautions and to quell reluctance to take the vaccine, unquote. By reversing course now and saying none of these things matter, all we would be doing is reinforcing this false belief that we can just pretend everything is fine because we have made some progress. Instead, let us actually finish strong, like this supposed, slogan that our government has trotted out offers. We have to keep doing what we're doing. We have to actually finish what we're doing. And then we can have a good summer, and we can have a good fall, and people can go back to school as normal. There are a lot of people right now who are getting vaccinated, and that's great news, but there's far more who are not, or who have only one shot. That's not enough. And there's furthermore a lot of people who have health vulnerabilities, who have not been included in these priority groups yet and who are still at risk. And the only way for people to remain healthy is to actually pull together. We've heard a lot about individual freedoms today, but a pandemic is not about individuals. It is about caring for other people. It's about doing what you can to help them. And there are people here who have raised great points about their trauma, and I do feel for them. The rest of us need to do what we can in order to help each other. And these are simple things for many of us. I'm not going to deny that there aren't hardships and there aren't difficulties. But Lincoln is operating right now with most of our businesses open and with the opportunity to do many things. Our individual liberties are far less at risk than individual lives in many cases. So please, let us actually finish strong. Let us actually continue to do what we need to do until we get to numbers that suggest we are at herd immunity, until we get to numbers that suggest we have a low transmission rate, until we get to numbers that suggest a low positive testing rate. Just yesterday, I believe it was reported that the testing positivity rate was still around 20%, even with the small number of cases that came in. That's too high. That's not giving us the whole picture. So until we really know what's going on, until people are really safe, we just need to tough it out a little bit more. Emergency doesn't mean it's over in 5 minutes. Emergency means it's something you have to keep dealing with. We have to keep dealing with it. Thank you.
Thank you.
I'll recall Jennifer Amend. Is she back? If not, that is the last name I have on my list for 4E.
No. Okay. If there's nobody else to speak, we'll end the public hearing on this subject. We'll move on to voting on our resolutions.
Item 4A, accepting and approving the report of new and pending claims against the city for February 16th through February 28th, 2021, introduced by Bowers.
So moved. Second.
And then moved and seconded by Councilman Christensen. Any comments, questions, thoughts? Seeing none, please call the roll.
Christensen,
Yes.
Ward,
Yes.
Washington,
Yes.
Raybold,
Yes.
Schob,
Yes.
Bowers,
Yes.
McGinnis.
Yes.
Motion carried 7-0. Item 4B is assessing liens for costs of registration fees and penalties for neglected buildings on properties generally located at 5320 Layton Avenue, 2958 North 54th Street, 5120 L Street, 1609 South 27th Street, 1641 South 6th Street, 3015 N Street, 1920 South 11th Street, 2626 North 36th Street, 922 South 20th Street, 234 South 38th Street, 3141 North 48th Street, and 1028 Furnace Avenue, introduced by Bowers.
So moved. Second.
Been moved and seconded by Councilman Christensen. Any comments or questions? Seeing none, please call the roll.
Raybold,
Yes.
Ward,
Yes.
Christensen,
Yes.
Bowers,
Yes.
Schob,
Yes.
Washington,
Yes.
McGinnis.
Yes.
Motion carried 7-0. Item 4C, assessing the costs incurred by the city for building demolition on property located at 2626 North 36th Street, 820 South 9th Street, and 3015 N Street, introduced by Bowers.
So moved.
Second?
Been moved and seconded by Councilman Raybold. Any comments or questions? Seeing none, please call the roll.
Schob,
Yes.
Raybold,
Yes.
Christensen,
Yes.
Washington,
Yes.
Ward,
Yes.
Bowers,
Yes.
McGinnis.
Yes.
Motion carried 7-0.
4D has been removed.
4E, approving a resolution to end the declared state of emergency for COVID-19 in the city of Lincoln, introduced by Christensen.
So moved.
Second.
Been moved and seconded by Councilman Washington. Okay, any comments? Do you want to go first or last?
I'd rather go last, just,
Okay.
I won't say much.
Okay. Anybody else like to have a comment at this point? Councilperson Ward?
Thank you. Yes, thanks, Mr. Chair. I was thinking about what I was going to say, but it's changed a bit through the course of the hearing. I intend to vote against ending the resolution, and that's probably not a surprise to many of you, but I do want to say just a couple things in that regard, and boy, hearing from the physicians, I don't know how anybody cannot respond when you hear a doctor talk about a wall of love at a person's end of life. And so I was particularly moved by that and a lot of the evidence that we've heard today. I also want to call out 4 constituents that I think emailed us after our hearing started. And I'm not sure that we all know that. I hope we do. But one, I did not ask her permission, but I know we have, for the record, and I'm not going to read the letters or emails, but people that wrote us against ending the emergency declaration. Zoe Olson with the Nebraska Restaurant Association, Michelle Tilley, Cindy Ryman Yost, who lost her father to COVID, and then somebody whose name I won't say, but did contact me during our break. So I wanted to make sure and note that. The other things I want to say, as I've been thinking through this, is my own experience is something I think we all draw on when we think about votes like this. And mine goes back to another constituent email that I got over the weekend, actually, from a former coworker of mine. And some of you know him, and I did get his permission to use his name, but Brigadier General retired Dale Williamson, who many of you know, sent me a really, I think, powerful email that I asked him to come today, but he could not. He had a conflict. So I just want to read you a couple excerpts. But what it reminded me of in my past life was traveling around the state with my former boss, Senator Ben Nelson, during the Affordable Care Act, and taking a very controversial issue on the road, and listening to a lot of passionate testimony that we've heard today. And I think it reminded me of things he used to say, but certainly managing a lot of fear on both sides. And I think I want to say to, no matter what side you're on, I think we've all been fearful. This past year, we've all lost something. But Senator Nelson used to say on the road, and Dale Williamson reminded me of this, we're all entitled to our opinions. We all are, no matter what that is. We all are. But what we're not entitled to, and I've been guilty of this as well, is the facts. We're not entitled to dispute the facts. And in this case, for me, it's the science, and it's clear, and it's real, and that's what I believe, and that's where my moral compass is. So just quickly, I want to read a couple lines from Dale Williamson, again, retired Brigadier General, age 90, going on age 40, because he couldn't be here. He says, "Hi, Tammy, it was so nice to read Dr. Bob Ronner's YouTube message this week regarding the terrific work you are all doing and trying to take care of all of us in Lincoln regarding the pandemic. His guidance was outstanding, and the community has fared better than most others. When I received my COVID vaccines, I couldn't help but think back to the Affordable Care Act meeting where we all participated when we were in Lincoln with Senator Nelson at Madonna. While I was helping someone in the line, and this is General Williamson, one lady was so incensed about the proposed act, she told me the government has to just get out of everything. I truly hope that that same lady now appreciates the great service provided by the government to provide our free of charge vaccines to defeat this horrible disease. These clinics are well organized, no time is wasted, and comments are very positive. Just think, if the government was not around to push vaccine development, provide distribution, and provide locations for free distribution of vaccine shots, what a world we would be in right now. The cost to each individual would be very high. Many could not afford a vaccine, and the choice for all of us would be grim. So my thanks to each of you for our great local leadership to make sure there was a plan in place to provide much needed service to all. I am very proud of our local leadership. Have a good rainy weekend. my best, Dale Williamson, Brigadier General, retired. So I just wanted to share that with all of you on his behalf. And that's all I have. I will be voting against ending the resolution. Thank you, Mr. Chair.
Thank you, Councilman Ward. Anybody else at this point? Yes, Councilperson Washington.
Thank you, Mr. Chairman. I really appreciate how much people have wanted to talk about the emergency declaration. I am very pleased that people have sent in dozens, well, a lot more than dozens of emails about this on both sides, and that we've had people who were willing to stay late at meetings to express their support or their displeasure. Ms. Rice was right earlier this afternoon when she said that I was interested in wanting to understand the impacts of removing the emergency declaration for accounting purposes. Having worked in the federal government and having worked with FEMA, I know that it mattered that emergency declarations were in place in order to receive those federal funds. I'm glad to hear that there is some mechanism for asking for continued support, even if that declaration isn't there. But there's not as much confidence in that as there is in having the declaration. Knowing that we still have the flood declaration, emergency declaration open, and that has not caused undue stress or harm to anyone, and that's really to allow us, as Mr. David Saber has said, ultimate flexibility in receiving state and federal funds. I am not as concerned about the emergency declaration being left open on this emergency. A lot of people have said that we have abdicated our rights because the mayor issued an emergency declaration which was only supposed to last 72 hours. Council on the same day, last March, issued an emergency declaration, and there is no limit on the issuance of that. It is in place until we rescind it. We have not abdicated our rights or our responsibilities in this. We have issued our own emergency declaration, and that is the emergency declaration that we are under right now. I clearly understand that there is concerns about people and DHMs and the masks. There are exceptions, and many people have chosen not to wear a mask for whatever reason, and I realize I don't have the right to ask them why. That's fine. I choose to wear a mask. Most people in the medical profession choose to wear masks. That's what I will do for my family and for my community. I will be voting in opposition of ending the emergency declaration.
Okay. Thank you. Councilperson Rabel.
You know, we heard a lot of testimony today, and I'm thankful to all who came down to testify. I'm thankful for the many emails that we have received. Some of the testimony has been heartbreaking, some clearly highlighting the frustrations and struggles we all have faced as we deal with this pandemic. Our work on the City Council is important. We have the honor to protect those in our community and to tell them the truth during times of crisis. It is not up to us to convince them, but to keep those in our community safe, to protect and defend the institutions that do the hard work and make the very, very difficult decisions, knowing that it will impact lives and livelihoods. Here are some of the things that we've heard, and here are some more facts. The pandemic is real. It is not a hoax. It is not a farce. We have lost more lives because of COVID-19 than in World War I, World War II, the Vietnam War, and 9/11 combined. The 1918 pandemic was also real, and sadly, 675,000 American lives were lost back then. We are approaching that number with COVID-19, with over 533,904 lives lost. And we are still losing 1,500 lives each day. 1 in 3 American families are grieving. Think of that. What would our numbers be without the amazing advancements of science and medicine since 1918? We've heard from some of our emergency experts, it's essential to have the emergency declaration in order to maximize our eligibility for federal and state emergency funds and services. We know patience is still needed as we are truly only in the response phase and not yet in the recovery phase of a declared emergency as stated by our experts. An emergency declaration is critical in securing funds for PPE, business loans, food and housing assistance, and child care assistance for those who have been so cruelly impacted by COVID. We need these funds to safeguard our children and keep our schools open. We have heard a lot from some that it is a power grab by our mayor or it is a parliamentary gamesmanship being played by the city council, just not willing to do their jobs. The rule on not addressing items on the agenda during public comment or open mic have been around since 1999. That's 22 years. And I'm pretty sure that rule will still be around after a lot of us, if not all of us, are no longer serving on the city council. We also heard today that 90 out of the 93 counties in Nebraska are currently under an emergency declaration. Lancaster is one of them. There are also 208 municipalities in Nebraska, like the city of Lincoln, that have declared a state of emergency. Ms. Rice was incorrect. Our state of Nebraska is still under a state of emergency. What you are seeing and at times complaining about is good, responsible government doing what good, responsible governments are supposed to be doing, looking out for those harmed by the pandemic or the flooding or any disaster for that matter. I want to thank our mayor for her leadership. I want to thank our health department for their courage. We are forever grateful to our incredible, outstanding, and exhausted health professionals who have worked tirelessly in keeping our loved ones alive and giving selflessly of themselves in this effort. You are our true heroes. I also want to thank my colleagues on the City Council for supporting the DHMs and drafting other critical creative legislation that has helped those businesses and families at risk and that are still struggling. You are the problem solvers, the peacemakers and stewards our city has been so fortunate to have during this time of crisis. Together, we have kept the cruel death toll low, and I thank you. I know it has been very difficult and really challenging at times. However, I also want to criticize one colleague for being irresponsible and reckless, who has intentionally undermined how essential an emergency declaration is to the well-being of our entire community in order to placate and pander to the loudest and most irrational and self-centered voices in our community. You, sir, demonstrated a lack of leadership when you introduced this dissolution of the emergency declaration, your lack of research and deliberate ignorance from someone who has served the longest on the City Council. Instead of educating and informing those in our community, you chose to foment, incite, and support misinformation. I was wondering, when were you going to tell some of our constituents or say something about the rule about not addressing items on our agenda during public comment open mic has been around for 22 years. That is wrong. As elected officials, we need to dial down these tensions we see in our community, not feed on them. The good news is that our DHMs are working and keeping our families, schools, businesses safe and open. We have 3 vaccines protecting our seniors and soon to be protecting the rest of the community and allowing us to achieve some normalcy, but not quite yet. Most of all, I want to thank our resilient, responsible citizens in Lincoln for testifying today and doing actions like wearing a mask and washing their hands and safely distancing faithfully and selflessly because they care about our community. We know it has not been easy for any of us. We all do this for the common good and to demonstrate we care deeply and greatly about our fellow community members and their well-being and want to do our part in keeping them, our essential workers, and all our families safe. I will not be supporting this resolution to dissolve the emergency declaration until such time as our health experts and disaster experts advise us to do so.
Thank you. Councilperson Bowers.
One thing I've learned from some of the best role models that I've had is that with growing up is that leadership and doing the right thing are not always easy. It would be easy and more comfortable for me to vote along with the demands to end the emergency declaration right now because of who's in the room. It would be easy for me in this moment and comfortable for me because that's who's around. But the easy thing isn't always the right thing to do. I would like to share a timeline of some events and some facts. When this resolution was first proposed, I was surprised because of the lack of consensus building that came with it at the beginning. My mother was recently released from the hospital. I'd received calls from Lincolnites who had family members die because of COVID, and we were still in the red zone. It felt disrespectful to move forward on a resolution as constituents of mine were dying and suffering. The council decided to shelve this ordinance so we could revisit the emergency declaration at a time when things became more stable. When the dial went to mid-yellow, the council began to discuss how to reopen the chambers and the emergency declaration, what the risks would be, what the benefits would be, and what would be the right course of action. As conversations continued, I chaired an open microphone session. I knew that there was going to be a desire for folks to be heard and a desire for answers. So that's why at the beginning of the meeting and at the beginning of the open microphone session, I stated that we were going to continue to look at how to open chambers up and we would have an answer in the next week. Reminded folks of the rules of and the decorum of the council, and asked for specific things from the community to testify on, knowing that folks would be frustrated on how the rules were out. So I asked for feedback and encouraged people to testify on the process for opening chambers up, the process for how we can improve these open sessions, and provide feedback on the directed health measures because they're not related to the emergency declaration. I'm going to share this next statement just for context, but over the summer, Councilman Christensen raised concerns that we had lost control of our chambers and sought to bring forward a ban on signs during meetings and reinforcing a chair's ability to clear the room. He stated that these distractions were disrespectful and that we must work to uphold decorum. I voted against that measure because I did not want to limit a person's expression and felt that we as adults, we had the ability to maintain our focus despite any sign battles that were happening in the chambers. After that vote, my statement was the following, and I think it's still true today. We're experiencing a moment where people are divided, polarized, and frustrated on a wide range of issues. However, the one commonality is that people feel like their government and their elected officials are not listening nor accessible. The council already has rules in place to maintain decorum and process, and I cannot support action that would further restrict a resident's ability to be heard or seen by those that were elected to serve them. The council voted and followed through with that ordinance to maintain decorum, and even though I voted in opposition, and even though I didn't agree with it, I wanted to honor the council's ruling on that as I took on the responsibility of chairing that session. However, after that public hearing, there was a political campaign video that was created, and I can't help but feel just a sense of broken trust with the process. We won't always share an opinion as a city, but hopefully we can agree on the facts. And however, when the unfortunate scenario occurs where we can't agree on even the basics, having that protected process puts in place a process that ensures that our shared system of government survives. And when we start to abandon that because it's the easy thing to do, we're shaking our responsibilities from the right thing to do. We've received a lot of emails and heard testimony about concerns about this emergency declaration. And there's a couple things that I just want to set straight just for the record. One common theme is that please stop abdicating your responsibilities and take your job back. The council has continued to meet weekly and conduct city business. We've approved an affordable housing plan, created a process for the city to purchase from local businesses, created the regulations for transitional living facilities to keep neighborhoods safe, developed exceptions for bars and restaurants so they can use sidewalks and streets during game day. We've accepted grant funding to fund more police officers. We balanced a budget, and with Councilwoman Ward's leadership, we've ensured full benefits to families of fallen first responders, all on top of our normal business of liquor applications, annexations, and developments. We've heard a lot of statements about ending the mask mandate, and almost all the emails that came in relation to the emergency declaration touched on this. But the emergency declaration and the mask mandate are two different things. Kind of similar to that, we've heard statements that we're living under a dictatorship or that we have tyranny. But the reality is that the mayor has not wielded any emergency powers related to the pandemic. Our emergency manager, Jim Davidsaver, stated that this declaration expresses to disaster aid officials at the state and federal level that Lincoln still needs assistance. Removing the declaration would bump Lincoln down on the list when pandemic resources or funds are being distributed. If you do not have a disaster declaration, essentially you're not asking for help from the state or federal level. And as our state has an emergency declaration, 90 out of 93 counties and 208 cities within Nebraska have an emergency declaration. Why would I take an action that would put another city or another county ahead of the one that I was charged with protecting? When families are calling me up and saying that they're struggling, why would I say thanks but no thanks to aid that's being offered? I'm going to do everything I can to ensure that the neighbors in our city get all the help they need. The council's continued to do its job. The directed health measures do not come from the city. The mayor has not wielded any emergency powers related to the pandemic, and the majority of counties and cities have a declaration, and I want to make sure that Lincoln gets a first shot at getting assistance. Doing the right thing isn't always the easy thing, but whatever the consequences are of supporting this emergency declaration, I know that I can sleep at night knowing that I did everything I could to support our neighbors.
Thank you. Councilperson Christensen.
When we began this evening, I noted I had two goals. One was to have a vigorous public discourse on this subject. I think that's been achieved. The other was to hopefully dispel some of the misunderstanding and confusion about what an emergency declaration is and what it is not. I get the feeling we failed at that because almost everybody that discussed this in front of the council talked more about DHMs. Nothing in this resolution, if it were to pass, which it will not, would have any impact on any DHM or mask mandate. That's not what it's about. So to the citizens of Lincoln, this is not about DHMs. It never was. It was never about mask mandates. It's still not about those things. It's a completely separate issue. But apparently the message hasn't come through. The city staff was very clear. These are two separate things. So I expect I'll be the only one that votes for this.
Okay, anybody else? Seeing none, you can call the roll.
Ward,
No.
Christensen,
Yes.
Bowers,
No.
Schob,
No.
Washington,
No.
Raybold,
No.
McGinnis.
No.
Motion lost, 1-6.
Okay, we're going to take a quick 5-minute break, and we'll be back at 6:35. Thank you. I'd like to call the Lincoln City Council meeting for March 15th, 2021 back to order. And we are moving on to item 5, correct?
They are our public hearing ordinances, second reading, and related resolutions. I'll be calling 5A through 5C together. Item 5A is the Comprehensive Plan Conformance 21001, application of the Urban Development Director to review as to conformance with the 2040 Lincoln-Lancaster County Comprehensive Plan, the Wayuka Redevelopment Plan, including the Gatehouse Row redevelopment project, generally located at 3600 R Street. Related item 5B, which is the change of zone 21004, application of Gatehouse Row LP for a change from P Public Use District and R2 Residential District to R4 Residential District. And 5C, the appeal by Tony Rodriguez of Planning Commission approval, special permit 21003 to allow for a community unit plan.
Okay, Director Marvin, we'll start with you.
Good evening. Dan Marvin, Urban Development. I'm here to introduce the first of the 3 items that were brought to you. The second item is a zoning change, and the third is an appeal from an approval at the Planning Commission. This is a plan amendment that has went through a public hearing at the Planning Commission on February 17th and was approved on a 6-0 vote. Earlier, the Planning Commission and this body had approved a blight study for this area, again on unanimous votes. On February 2nd, the project went before the Urban Design Committee for review of the building design, and I think that that project was approved at that point. On January 21st, the project was reviewed by the Historic Preservation Commission, received a 5-0 vote that the project does not negatively impact the Wayuka Cemetery. My comments at the Planning Commission, I think, are pretty much the same, that this project checks a lot of boxes for us in terms of the Affordable Housing Action Plan. Presently in the city of Lincoln, 44% of renters in Lincoln are cost burdened, which means that over 30% of what they earn is paid out in rent and utilities. And 22% of renters in Lincoln are extremely cost burdened, meaning over 50% of their wages are paid out in rent and utilities. There are a limited number of parcels in the city of Lincoln where you could do a project of this scale, and the project would bring 98 affordable housing units, and that those affordable units would be available to people who make at 60% of area median income, and that they would not be cost burdened to those individuals, meaning that they would not be paying more than 30% for rent utilities. There have been a number of changes to respond to issues that were brought either at planning or at the neighborhood. I think the key one would have been parking. Parking's all been moved on site. And I can stop there, certainly answer questions. I know Tom Houston and others have a PowerPoint they'd like to go through and explain what the project is, and I certainly would be here afterwards to answer questions as well.
Okay. Any questions for him now? We know where you are, so we can find you.
You can find me.
I brought a technical expert. She's disclaiming it, but
you're getting smarter in your old age.
Mr. Chair, members of the council, my name is Tom Houston. My address is 233 South 13th Street, Suite 1900, here in Lincoln. On behalf of Gatehouse Row Limited Partnership, with me today is Fred Hoppy. Jake Hoppy, the other portion of the limited liability company developer, is stuck in the snowstorm in Colorado. Otherwise, he would have been here also. Tim Gergen is here with us today, project engineer, if you have any engineering questions. Your agenda of the 3 items, all of them are important for this project. The comprehensive plan conformance issue is very important for adopting the redevelopment plan for this project. The change of zone, the property owned by Wyuka Cemetery was a P public zone, since Wyuka is a public corporation, and it needs to be changed to the R4 zone, which is crucial for this project. And then also the special permit for the community unit plan on appeal is vital for this project. I would make the request that that you take action on all 3 items today, and I ask you to waive the 3rd reading of the change of zone, so you can vote on all 3, primarily because the Nebraska Investment Finance Authority, which is the funding mechanism, the financing for this project, has a deadline for its application of March 19th, which is this coming Friday. And if you are supportive of this project, I would ask you to take action so that we can score more points in that competitive process to receive an allocation of tax-exempt bonds for financing purposes. So even though all 3 things are important, really what I want to talk to you about was the density of the project, because that's really the only point of contention I think that we had throughout the negotiations and discussions we've had with the neighborhood and the city throughout this project. And in the city of Lincoln, like most cities, our land use regulations are designed to help us achieve many governmental objectives. We have land use regulations that foster historic preservation, for example. We have land use regulations that deal with traffic mitigations. We have regulations that require us to deal with floodplain management. We also have our zoning ordinances intended to address affordability also, and it has received renewed emphasis over the last few months. The 2040 comprehensive plan that was adopted 10 years ago talks about affordability a lot throughout that plan. Talks about the variety of different housing options. Talks about removing barriers to affordability and removing barriers to density within our community. As Dan mentioned, one of the challenges that we have in the city of Lincoln is the affordable sites in the built environment. We've done a pretty good job of building some affordable housing projects on the perimeter, but that's not close to the public services that we need. That's not close to the public transportation needs. So we're really looking for more infill projects that are within the built environment. This site is fairly unique. Find a site within the built environment of 8.75 acres is pretty unique and satisfies many of those requirements. We have a renewed emphasis on affordability because of the new action plan adopted by the city. And there are several things, I can remember how to do this. There's several goals of the action plan I think are important for us to look at today. One goal is to maintain the supply of existing units. One of the unique things about this site, it's currently vacant. It's not developed. There's no units that would be lost as a part of this development. But the most important goal, I think, is to expand the use of the low-income housing tax credit tool in the city of Lincoln. That is a priority goal within the action plan. And the action plan also sets forth a goal of developing 5,000 dwelling units over the next decade. That's ambitious. In order to be able to do that, we have to be able to utilize all the tools at our disposal, and we have to achieve some scale in this effort to build affordable housing. I'm not going to get into the details of the low-income housing tax credit tool as a financing. Fred may talk to you a little bit about that, but suffice it to say, there's 2 different methods that we can go, and Lincoln has not used a tax-exempt bond deal for 20 years, to my knowledge, and we have an opportunity because NIFA, Nebraska Investment Finance Authority, has tweaked its action plan to couple it. Nebraska is one of 18 states that has a state low-income housing tax credit, which really helps. It fills the gap and makes the financing affordable, and that's the application that we're trying to submit by March 19th. One of the other goals of the action plan is really create partnerships to leverage the tools that we do have, and Fred will talk to you a little bit about the lenders and the investors that we intend to work with. But one of the purposes is we're trying to create a template, create a structure that is repeatable, that we can use multiple times over the course of the next decade to bring some additional units to achieve that goal of the comprehensive plan and the action plan. So the real issue is density. We've had multiple conversations with the neighborhood. The neighborhood would support a density of 54 units. Initially, the planning department supported 80 units. I can tell you this project only works when you have a unit count of around 100. And that's the nature of the tax-exempt bond financing. You couple tax-exempt bonds that requires at least 51% of the total project cost be paid with bonds, and it's coupled with a 4% tax credit, and to achieve the scale that you really need from both a capital cost and an operating cost, you need to have approximately 100 units, and that's why we're looking for 98 units for this project. So both the comprehensive plan and the action plan talk about how to build density that is compatible with the existing neighborhood, and that's something we really try to do. We try to be respectful of the neighborhood and work with them. And one of the things that you can see is the design of the project itself. I think the design with the gable roof lines, this is not your 3-story multifamily property that you see being built all over the city. This is really designed to look like individual housing units with 6 clusters of dwelling units scattered over about a 4-block linear stretch. And these housing units will have porches, they'll have decks, they're really at the edge of the neighborhood. This project will have amenities such as a walking trail, community garden, and a playground. And as Dan mentioned, we did try to address the design aspect. Originally, we were contemplating, at least proposing, that all the parking be located in the public right-of-way. 36th Street is unpaved at this point, and it will be paved as a part of this project, and we had contemplated putting all the parking in just a row adjacent to 36th Street. The neighborhood found that offensive, found that troublesome from a parking management perspective, so we moved it all off-site. Our parking count right now, we've asked for, one of the waivers we've requested is to reduce the 2 stalls per unit to 1.4 stalls per unit. Mathematically, the requirement would be 137 stalls at 1.4 stall per dwelling unit. And you'll see that our parking count on site, off street, is now 141 parking stalls. Plus, we're building 2 new streets, and our engineer tells me that we'll have approximately 55 to 60 new on-street parking stalls as a part of this project that do not exist today. As Dan mentioned, we have been to Urban Design Committee, we have been to Historic Preservation Committee, and the Planning Commission did recommend approval of not only the change of zone, but the comprehensive plan conformance issue, and then the special permit on a 5-to-1 vote. So I want to talk briefly about what this project will bring to the city. It will bring 98 dwelling units that are 100% affordable. All of the dwelling units will be affordable to individuals making no more than 60% of area median income. What does that mean? HUD publishes this information. 100% median income for a family of 4 in the city of Lincoln is approximately $82,000. The 60% requirement, so a family of 4 could make no more than approximately $49,000. In addition, 10% of these units will be made affordable to families making no more than 40% of area median income, and that's approximately $32,800. These requirements, these impositions, are as part of the process in participating in the low-income housing tax credit project, and they're enforced through a land use restriction agreement that both the investors and the Nebraska Investment Finance Authority are very vigilant to enforce. There is constant compliance requirements for a 30-year time period. And the Nebraska Investment Finance Authority, in addition to tenant compliance issues, they also examine the physical structure for a 30-year period. So the project has to be well maintained and be rentable within the community. So with that, in conclusion, I just would renew my request if there's support for this project, and I think that this is a project that is repeatable in the city of Lincoln. But I would request that you waive third reading on the change of zone. There's only one item on your agenda that really requires a third reading, and you do have the statutory power to waive that, so that you could take action on all 3 items. And with that, I'd be happy to try to answer any questions that you may have.
Any questions for Mr. Houston? Yes, Councilperson Washington.
Thank you very much, Mr. Chair. Mr. Houston, good afternoon, evening. I have a question about the makeup of the project. If you would just illuminate how many, 98 units is what you're asking for. A lot of folks have comments about.
Strong emphasis on 1-bedroom units and 2-bedroom units. Of the 98 units, 4 of them are 3-bedroom. 46 of them are 1-bedroom. So the differential is 48. So 48 two-bedroom, 46 one-bedroom, 4 three-bedroom. According to my count, that's 154 bedrooms.
You add faster than I do.
Yeah. 154 bedrooms, and that was really our goal in trying to achieve with off-street parking requirements, and that's why we actually decreased the density slightly to increase the parking areas so that we could try to achieve a 1-to-1 ratio between a parking stall and a bedroom. I think there's a lot of statistical information that would support the fact that a lot of these residents, if they are 40% of area median income, will not have vehicles. And I think that history has borne itself.
I was doing some research. It sounds, I think you're right. I'm looking at that Hartley track and seeing that renters without vehicles in the last decade has increased from about 2% to 17%.
Correct.
Councilperson Rabel.
Mr. Houston, I'm looking at the NIFA application, and can you talk a little bit, what's the difference between the 9% LIHTC competitive application that you're trying to get submitted by March 19th and like the 4% LIHTC bond competitive application?
Sure.
Which one are you applying for?
We're applying for the 4%.
The 4%. And the 4%, does that represent the interest rate, or does it represent 4% of the project?
4% of the project cost is, you'll be able to size your tax credits based upon 4% of the project cost that is awarded by the Nebraska Investment Finance Authority each year for 10 consecutive years. So it will fund a portion of the project cost, and what happens is then you find investors that can use those tax credits. And their return is not based upon the rents that are received. Their return is based upon offsetting their federal income tax liability on a $1 for dollar basis based upon their investment in the tax credits. And that's how the federal government has incentivized the development of affordable housing. Now, the reason that we're going after the tax-exempt bonds coupled with the 4% tax credits is that it's still competitive, but it's less competitive than the 9% market. The 9%, you get 9% of your project cost each year for 10 consecutive years. In tax credits, you receive an allocation of tax credit equal to that amount. But the Nebraska Investment Finance Authority is able to fund about 1 out of every 5 applications. So it's a very competitive process, and it's a very scarce resource. And it's been a resource that's been around since 1986, and we've built over 3 million dwelling units across this country using this tool. It's awarded to each state based upon its population. So obviously Nebraska, with approximately 1.9 or 2 million people, we don't get the same amount of tax credits that larger states do. But Nebraska Investment Finance Authority has done a very good job of leveraging it with other tools that we try to use for financing purposes.
Thank you.
Any other questions for Mr. Houston? Yes, Penny.
Thank you, Mr. Chair. Mr. Houston, thanks for coming down. As you said early on in your presentation, one of the biggest points of contention is density. Mm-hmm. How does this compare to other developments, other multi-family units in the area?
First of all, I mentioned that this project is 98 units spread over 8.72 acres is 11.24 dwelling units per acre.
Okay, headache.
And the design standard for the R4 zoning district for a community unit plan is 13.93 dwelling units. So we're under the density design standard that is found in the City of Lincoln design standards for zoning ordinance. One thing that we do have available in the City of Lincoln is a density bonus. If you provide affordable housing, you're entitled to increase your density by 25%, and we're not even asking to use that. If the density was maximized based upon our current code, we could build approximately 148 dwelling units, and we're asking for 98 dwelling units. So according to my count, it's about 2/3 of the total density that would be permissible currently under the code is what we're requesting.
And I think you said, please repeat, that this is the only way it can be affordable, right? You can't afford to build it with fewer units.
Correct. We looked at the possibility of reducing it to 80 units, and it created a funding gap on our capital sources and uses in excess of, it's really about $540,000 that we couldn't close that gap. We couldn't fund that gap. And the new action plan adopted by the City of Lincoln asked the city to help close those gaps, the funding gaps that exist on building affordable housing beyond the financing tools that we have. And what we're asking the City of Lincoln to do is help us close that gap by allowing 98 units to be built. That way we can fund the acquisition of the ground and the construction of the units.
One other thing that we heard from, lots of emails from the neighborhoods and adjoining neighborhoods, and I'd like to thank everyone who reached out and contacted us, was the parking issue. We had some conversation earlier about fewer people driving. Those people who aren't driving, how are they going to get to and from their unit? Do you have any?
Well,
where's
it's
mass
one of the
transit?
beauties of this site. It's 2 blocks to the north and 2 blocks to the south, walking distance to public transportation. And bus route on O Street and bus route on Vine Street. That's one of the attractiveness of this site. And we think that's a real strong indicator of where affordable housing should be built.
There's some discussion, you're going to do there's some road, I guess, I'm going to call them streets. They're not really streets, they're gravel trails, kind of. You're going to pave most of those sidewalks, and bike trails will be included in that?
Well, in order, yes. New streets will be built. A Q Street from 35th to 36th Street is currently dirt or gravel, depending upon your description. It will be new, it will be paved and surfaced according to the city design requirements. And then 36th Street between R Street and S Street is also gravel or dirt, and it will be improved, also be paved and surfaced. And that helps handle some of the traffic concerns.
That was my next question.
Yeah, it helps really route the traffic back to O Street, I think in a more efficient manner, and cars and the traffic generated by the project, because it will generate some traffic. You know, we did have the project examined by a traffic engineer, and the conclusion was they wouldn't recommend any additional improvements beyond the surfacing of those 2 streets, and that the existing street system could handle the incremental traffic created by this project.
Thank you. Thank you, Mr. Chair.
Any other questions? Yes, Councilperson Ward.
Thank you, Mr. Chair. Thanks, Mr. Houston, for being here. Just a couple of things to follow up on. I was going to ask about traffic as well. And
I'm sorry.
No, it's good.
I take my question back.
It's been
Ask about
answered.
traffic.
It's good. And to the neighbors, thank you all for being here. I know you've heard a lot from them as well. So thank you for trying to address the concerns that we can. So a couple of things. And I talked to Mr. Hoppy about this morning, so he's not going to be surprised. Worst case scenario, we don't suspend our rules to vote this evening. What happens to the financial packaging?
We won't score as many positive points under the scoring system that NIFE has established, because we will not have letters of support from the City of Lincoln, which means there's a competing application that is being submitted that a different project may receive funding, and this one would not receive funding.
So you're at risk at less points, as you stated previously. Correct. Okay.
And to be honest with you, it was, we sat down right after Thanksgiving and mapped out a timeline, and our timeline included introduction on March 1st with a public hearing on March 8th and a vote on March 15th, and we missed it by a week. And it's because the publication requirement of the comprehensive plan conformance issue.
Okay. Thank you for that explanation. So here's a question I was asked this morning by a constituent on the phone, and I didn't know the answer. And maybe it's for someone else, maybe Mr. Marvin or Mr. Hoppy. Are there concerns about unmarked graves in the area of the development at all?
None
Not that
that
you're
I've
aware
heard
of.
of.
I could tell by your expression.
No. The entirety of the site that we're looking at for the development is located west of the drainage channel that is owned by Wyuka, but is actually you can see the legal description included in our applications. It was actually platted for residential development. So that's the first I've heard of that concern.
Me as well, but I told I would. You as well.
I've been
Okay.
asked, yeah.
Thank you. Thank you very much. Thank you, Mr. Chair.
Any other questions for Mr. Houston? Seeing none. Anybody else from your team like to come up? Good evening.
How could I not take the opportunity to talk? My name's Fred Hoppy. I live at 1600 Stony Hill Road, Lincoln, Nebraska. and I've lived in Lincoln almost all my life. I'm a builder. I build affordable, which is low-income housing tax credit, and workforce housing. And for the most part, I do it in other communities in this state that I've been invited into to build. Why not Lincoln? Because Lincoln's doggone hard to build in. I did a project at 10th and Military, which is called Creekside, which was probably about the last big affordable housing project Lincoln had, except for the veterans, I think. And I don't know all the numbers, and I may be a little bit off on that, but I bet I'm not. But the one thing about what we're trying to do with this project, we're trying to put together a template, a way to move forward to address Lincoln's affordable housing deficit. And there is a genuine and sincere lack of affordable housing in Lincoln. When you put together, if you look at the affordable housing plan, and I championed that plan, and that plan's not perfect, but it's taken us a direction. And if you look at the plan, you'll see that the only way you're going to reach the densities or the targets you have is if you use low-income housing tax credits. And there's two kinds of tax credits. Jane asked about them, or Councilperson Raybold asked about them. And the 9% is basically a very competitive process where you'll put in an application and they'll grade it, and if you get an award, you get 9% of the basis, and basis is essentially what your building cost. What you improve the property with on site is basis. 9% project, you get 9% basis. If you do a 4% project, you get 4% against your basis in tax credit. And then we go syndicate that tax credit. We go sell it. We deliver it to a syndicator. In this case, we put together a consortium of banks from Lincoln, 3 banks from Lincoln, that have agreed to buy the tax credits and buy the bonds. So we have, and this falls in, if you read the affordable housing plan, it falls in under the plan. It says, put together lenders in town to work and provide your financing. We did it. This thing's going forward. But when you do a bond deal, it takes about 100 units. And you can go look at all of the NIFA bond deals that they've done in the last 20 years. And you'll see 100, 120, 140. And you'll also see they're all in Omaha. Why? Why is it so hard? Omaha's got sites. There aren't sites to put together 100 units in Lincoln. There haven't been. And they have sites in Omaha that are in qualified census tracts that gets a bonus in award of the tax credits. So there's a lot of reasons why the number's important, the density's important, but not the least of which is if we provide 100 units, that's 100 units that goes to the 500 unit goal a year. And it takes a long time also to put together these affordable housing projects. So you got to look at that when we're reaching the thing. And that's also why it's very important to us to have the zoning in place on Friday when we turn in the application. And the reason Friday's important is because NIFA is only giving $20 million worth of bonds, a match with the 4% state tax credit. And that $20 million worth of bonds is going out to all the counties in the state. But each county can only have one application that gets an award. Well, we want ours to be the one for Lancaster County. And we think that's significant for Lancaster County to get 198 more units of affordable housing. You know, during the process, we met with the neighbors numerous times. We tried to incorporate for the neighbors their comments into our design. And we went out and got some designers and really upped the, in my opinion, made a first-class response so that the project we have along there is porous, it feels good, it's on the edge of the neighborhood, and it works its way. It melds the neighborhood to the cemetery. And the Urban Design Committee thought it was great. And I'm telling you, if you can get good comments out of all of the Urban Design Committee, it's stunning. They always have a better way, each one of those designers. Well, by golly, they all like this. And we think is a good enough reason to support it as it is. So, to make a long story short, we'd ask your support for the change of zone. We'd ask your support for the redevelopment plan, and we'd ask your support to overturn the appeal or vote in favor of the community unit plan at 98 units and waive the third reading so you can do it all tonight. And I'd ask any questions. Tom covered the project, I think, really well. And the trick to affordable housing is not bricks and sticks. The trick to affordable housing is putting together your financing. And at 98 unit, this foots. If we had to drop it down, we'd have to go find soft money to put in it. And it's just, Lincoln needs to use that soft money on other projects. If you can find it, and it's not easy to find. So I'd answer any questions you have. You know, we're happy to move it forward, and we'd like to be doing more of it, and that's why we worked so hard to set up this template to get it to move forward.
Councilperson Washington.
No, I don't have a question.
I thought you had a question. I'm sorry.
He kept pointing at you.
I know.
I thought you were making I got a question move. I have a question, Mr. Chair.
Councilperson Show.
Thank you, Mr. Chair. Mr. Hoppy, thank you. While you were talking, it made me think of a couple of questions. One of the things you said early on was you wanted to try to establish a template.
That's right.
And then you also said the money's only awarded one project per county. Is that annually one project per county? And if we did establish a template, do you think they would increase that number?
So this year, first of all, 2 years ago, the legislature passed an affordable housing tax credit for the state. In implementing the affordable housing tax credit, they only put the match of affordable housing tax credit, state credit, with federal credit for 9% tax credit projects. A year ago, and year and 2 months ago, I, with a couple other guys, said, wait a minute, if we had 4% tax credits matched with the state tax credit, we could be building a lot more units. We could be putting together projects because that state tax credit fills the gap, fills the difference between selling the federal tax credits and what it takes to affordable housing. The reason it's a problem is because people's rents can afford this and it costs this to build. So you got that gap. And that's where you try and fill it. And low-income housing tax credits is one way you fill the gap. It brings equity into a project. So when we look at that, so we worked on that. And I talked to all of the board members at NIFA to get them to put a 4% match with the state tax credit match with the 4% credits. They do this in a plan. It's called a Qualified Allocation Plan, QAP. And it came out in the QAP this last year. But the director of NIFA went down to the state to talk about matching the force. As a result of that, they decided they would do it, but limit the amount of match to $20 million worth of bonds. Okay, so this project uses about $10 million worth of bonds. It's about 9.6 or 9.7. I can look up the exact number. I don't have it in front of me. But, so that's one project. One of the other things we lobbied hard to get, but we did get it, was Lancaster County and Lincoln has been way behind the 8 ball in allocation of low-income tax credit. Why? Because the scoring mechanisms really loaded the metropolitan, Omaha metropolitan area for awards of competitive tax credit. When they did the QAP for the 4% bonds, we were working really hard to lobby to make sure that Omaha and Lincoln were on par, were on a parity so that they wouldn't take all of those tax credits. And we got a limit of 1 per county. So that's significant. I don't know. I probably answered more than your question.
Yeah, a little bit, yeah.
But
you did answer.
If you talk about the mechanics of how low-income housing tax credits awarded and the 4% and how they're awarded, it all factors in.
Thank you.
Yeah.
Yeah.
Any other questions?
Any other questions for Mr. Hoppy?
Hearing none? Oh. Thank
Okay.
you.
Is there anybody else in favor or part of the development team that wants to come forward? Okay. Let's go to our list.
All right, first up we have Gayleen Hayes and then Samuel Lyon. Gayleen Hayes. And Samuel Lyon.
Yep, that one will work.
Samuel Lyon, Lincoln, Nebraska. I wanted to bring out a few points about the Wyuka Row House project. There for building row houses in the cemetery. And just address a couple points. There's 3 resolutions on the agenda. One of them is to change or to say that it matches the comprehensive plan conformance. And there was a couple parts of the application that I noted. Now, justification for the recommendation was the proposal is justified in that it will change the zoning to a largely unused portion of P public use property to R4, which matches the adjacent neighborhood zoning to the west. And that is true. R4, or 2 family units per property, is what the adjacent neighborhood is. But the intention of this resolution is not for 2 family units per property. The intention is for a much higher number of units. So that's one very large discrepancy between the neighborhood to the west and what is proposed to be built in the cemetery. A couple of key quotes also mentioned in the application of the comprehensive plan is the comprehensive plan's purpose is to, quote, strive for predictability for neighborhoods and developers for residential and development and redevelopment. Predictability is looking at the codes and knowing or having some level of predicting that they will continue to be somewhat the way they are, which is 2 units per buildable lot. What's being proposed is 98 units on 8 acres of land, which only has 4 buildable acres. So less than half of the total acres is buildable. So much higher density than what is currently in the neighborhood. Secondly, encourage well-designed and, quote, appropriately placed density. Appropriately placed density. Again, 98 units on 4 buildable acres directly across the street from single-family homes and 2 family homes. That's max 2 family homes. I initially looked at this during the blight study that came before this council, where a blight was issued on the entire neighborhood based on some stucco on some of Wyuka's buildings that was cracked, needed, quote, painting, some paint, some, quote, weather stripping on some of the doors, a roof that needed to replace, etc. And to blight the entire neighborhood for the sole purpose of gaining the TIF funding, I think is unfair to the long-standing owners and residents of the neighborhood that have been there for literally years and in some cases decades, taking pride in their property and keeping them up. To say, well, it's blighted now because we need tax funding is an insult. So the second thing that I notice is all the waivers needed to make this happen. And again, I think it's not because it's because the buildable acres are less than half of the total acres. The CUP allows for, I think, 13, and in the application they say, well under 13, we're at 11. However, that's for the total number of acres of 8. For 4 acres, that's 23 units per acre that would be on there. And so, of course, waivers are going to be required. For over height was a waiver that was asked for. Instead of 25-foot setbacks on the front, it's less than half of that to 10-foot setbacks. Instead of 25 setbacks on the side, less than half, 10-foot setbacks. And in the rear, instead of 25-foot setbacks, 0-foot setbacks is what they're asking for a setback from Wyuka. And if we could zone in on this, I have this is the proposed, I did notice that there are no cars in here. And I think that's because that's what the 0% setback is for, and also a waiver on cars, right? So instead of 2 cars per unit, 1.4. But the thing that I really wanted to speak on is here is the lot line. Right up to the edge is where they want to build that parking lot. And adjacent to that is Wyuka. That's where we bury people. And if you would notice that this, I pulled up from Wyuka's plan, these are plots where people would be buried essentially right on the property line. Someone might be changing their oil in their car and their legs sticking out, or dispute comes out of the family dispute, rolls out into the parking lot, and somebody's trying to bury their loved ones or visiting their loved ones right across the grassy area there. I think that we're trying to push this through too fast, and that's also exampled by the I guess suspension of rules that is being proposed to you to do it tonight. Again, not allowing people to have an opportunity to email the council. Too many waivers, too fast, to build row houses in the cemetery, I think would be a bad idea. So I would encourage you to think about those things. Thank you.
Thank you. You have a question?
I do. Mr. Line?
Yes.
That burial map from Wyuka, what's the date on that map?
I pulled it from Wyuka's website today.
And is it their plan for burials in this plot? I didn't mean that. In this plat?
So here's what I would say on that. This is the website that I pulled from Wyuka's website, right? These are plots. Right here is Babyland. This is just maybe, I didn't measure today when I was there, but maybe 30 feet from the property line there. I was there today and I took some pictures, and I will show you some actual headstones. I know that there was a historical association that marked it all off, and I don't know if they're here today or not, but they might give some more perspective. But this is the creek. Essentially, the creek is the lot line of where the proposed lot line is, and these are headstones. So that one is maybe 10 feet off from the top of the creek. Some of these were closer. Here's the top of the creek there. So it's an active burial site. They're not all full.
You're on the east side of the creek?
This is on the east side of the creek, correct?
Thank you.
Yeah.
Okay. Any other questions for Mr. Lyons? Nope. Thank you.
Thank you.
Up next, we have Tony Hoffer, and then Tony Rodriguez.
Okay, I'd like to go first.
Okay.
Is it okay with Tony?
Absolutely.
Appreciate it.
All he needs one more time.
The Tony team.
Yeah. I was thinking Tony.
Yes, sir. Yeah, I love them. It's our anniversary. That's me and my wife's song. Thank you to the council for allowing me the time to speak. My name's Tony Rodriguez. I live at 641 North 35th Street. For 4 decades, I'm a lifelong Hartley resident. I bought the house that I grew up in. I'd like to preface this with saying, unfortunately, our legal representation, Mark Hunziker, was not able to be here today due to a scheduling conflict. He's out of town. But it's my understanding that he has sent each of you correspondence and letters kind of defining our position and our concerns. I'd like to state for the record that the Hartley Neighborhood Association supports the city's efforts in its pursuit of more affordable housing, and at no point have we ever opposed the building of more low-income properties in already one of the most affordable neighborhoods in Lincoln. We simply are asking for a reduction in units for the safety and quality of life for not only the Hartley residents there currently, but also for future tenants of this proposed development. The Hartley Neighborhood Association has several concerns about the long list of waivers requested to allow substandard parking, inadequate yard setbacks, and greater building height. All the waivers are directly related to the excessive density proposed on a site, which is so constrained by the drainage ditch running its entire length that less than half the land, as previously stated, is buildable. In fact, even though the site is a nominal 8.27 acres, less than 4 of those acres are actually buildable and usable. The real density of the project, as previously stated, is closer to 25 units per acre rather than the 11.24 calculated, including the unusable land. The 1.12 acres east of the drainage way are proposed creatively to be a community garden. The garden site is inaccessible by vehicle and so inconvenient to the apartment buildings, and it is unlikely to be used even as a garden. Its only real purpose for inclusion in this CUP is to increase the overall density. The proposed outlets A and B together consist of a drainage ditch, which is both on non-buildable and non-usable. This area consists of 3.61 acres. The remaining 3.99 acres consists of a long, narrow parcel, which is too small to allow for normal setbacks on the front, rear, and side of the buildings, parking lots, and between buildings. The tiny bit of open space outside the drainage way is mostly occupied by a stormwater detention cell with only a small playground usable. Casual glance at the site reveals the land at the north and south ends the 4 acres that is buildable is also too narrow to either build or be useful. The waivers being requested for this project are all a function, of the site being too small and too narrow to fit 98 dwelling units and provide the parking, setbacks, and usable open space required by the zoning ordinance and design standards. The parking waiver is a density issue. If you look at the site plan, there's no place to put any more parking. Reducing density would alleviate this problem. Granting the waiver of 1.4 parking spaces per unit will force apartment tenants and their visitors to utilize neighborhood streets for parking. The traffic study that was done shows that an additional 717 average daily trips are going to be generated by this project. That's a 64% increase in trips through the neighborhood. They would all have to wind their way between parked cars on both sides of the 26-foot wide streets. Traffic density along 35th Street is already a major issue due to its unique position as being the first accessible street to the neighborhood when heading west on either O or Vine Streets. It's also the only street you can use to head east in order to avoid traffic lights. All the closest retailers, grocery stores, restaurants, those closest stores lie east of the proposed development. Let's see here. Anyone who's familiar with the area and neighborhood, like myself, knows that those residents, just like all current residents, will use 35th and Vine. Is that my time?
You got it.
Can I just?
Yeah, keep moving.
10 more minutes.
Please, can I ask for just a couple more, if I may? I appreciate it. 35th and they'll use the 35th and Vine Street intersection to travel east in order to avoid the lights at 33rd and O and 33rd and Vine. Why would they travel 3 blocks west, head either north or south to get to either light just to head east? This will make 35th Street, especially at the intersection of 35th and Vine, even more dangerous than it currently is. It should be noted that 35th Street is also a designated bike route with many pedestrians using that crossing to get to the Mopac Trail. LTU has stated that the streets can handle the increased traffic volume. However, the traffic study performed does not reflect the true nature of the density on 35th Street. It was done in December of 2020 during a national pandemic. Previous studies in 2019 showed a greater increase in traffic than the one done in 2020. Also, they studied 35th and R as well as 33rd and R, which are not true measurements of the true volume of cars in traffic that is seen through the neighborhood. The sheer number of waivers required actually, in order to fit so many units on the site, they're actually required to fit those units. The Harley Neighborhood Association has taken a serious and business-like approach to responding to this proposal. The density we suggest is more appropriate to the area and is supported by the Clinton and Hartley Neighborhoods Housing Study, which was done in 2015, which made specific recommendations for this exact parcel of real estate. It recommended a total of 48 units in duplex and triplex buildings. The study was funded by NYFA, NeighborWorks, some banks, and the City of Lincoln. There was significant neighborhood involvement, and the 54 units that the Hartley Association is requesting is actually a 12.5% increase on top of that. Finally, sorry for going over, but please keep in mind that this is one of the first projects to come before you. Since adapting the goal of creating 5,000 affordable housing units in Lincoln. To reach that goal, the city would have to approve a project of this size every 2 months over the next 10 years. There's very limited supply of infill sites to accommodate that goal. If you allow this project to define affordable housing projects as being excessively dense, inadequate parking, and virtually no usable open space or setbacks, you'll set the stage for bitter disputes over future projects. I apologize for taking too much time. If the council sees fit to postpone the vote till next week, I'm more than happy to take any of you on a tour of the site at any point. You call me any day, night time over the next week. Thank you though for your time. I appreciate it. Any questions for me?
Any questions? For Tony?
Thank you, Council.
Thank you.
I appreciate it. Thank you.
Up next is Tony Hoffer. Then we will have Thomas McChristian.
Hello. First of all, I just wanted to thank you all for this opportunity to speak with you. Very grateful to be here tonight. My name is Tony Hoffer. I live at 3226 Q Street.
I'm here in opposition tonight to the proposed 98 units. As a resident of Hartley neighborhood since 2009 and a homeowner since 2016, and finally as part of the board since 2019, I respectfully urge you to reconsider the density of this project. First of all, I would like to make clear that I'm in full support of and understand the need for additional affordable housing. I am proud to be part of an already culturally and economically eclectic neighborhood, and agree this land would be great for additional affordable housing in Lincoln. However, the 98 units proposed is simply too dense for this location. Not only do the current plans rely on limited parking, but there are no arterial streets connecting the project to Viner O Street. The scale of this project is anticipated to generate more than 700 trips per day through few residential streets. This worries me first and foremost for the neighborhood children that play in front of their homes and bike on the sidewalks and across the streets. It also causes concern for the Hartley residents in the area that currently rely on on-street parking, which most definitely will house the overflow vehicles from a project of this density. This project will forever transform the Hartley neighborhood, and it will set precedent for other similar lower-income neighborhoods for which residents often feel they do not have a voice. Secondly, I would like to express mine and my neighbors' concern for proper snow removal in this area. I live on Q Street, as I said earlier, between 32nd and 33rd Streets. And earlier this year, I was stuck in my house for days, unable to leave due to the delay of appropriate snow removal in the Hartley neighborhood. My husband, my neighbors, and myself spent multiple days pushing cars free that were stuck in the ice and snow due to parts of our neighborhood being neglected. It was a public safety disaster. This was not an isolated event, even though it was due to the historic landfall this year, as it is common that our streets are neglected year after year. I can't imagine the newer development will fare much better, especially given the plans of relying on only 1.4 parking spaces per unit. Overflow would most certainly find its way to the already crowded streets, congesting the streets during snowfall and inclement weather even more so than they already are. Weather is not becoming any more predictable or temperate. A project of this density puts the well-being and safety of Hartley residents and commuters at risk. Finally, Wyuka Cemetery is a historical and deeply loved park to Hartley residents. This historical preservation of the park is of utmost importance to myself and many other Hartley residents. Aside from the wall of the buildings that will line 36th Street, the R Street entrance, the park will almost certainly require additional upkeep and surveilling. Its historical integrity and preservation will undoubtedly be at greater risk given the dramatic influx of temporary residents that will occupy the proposed rental properties lining this historical park. The risk to the Hartley neighborhood and Wyuka as a historical park could be presumably curtailed by lessening the density of this project and encouraging the permanency of Hartley residents via affordable ownership options. Though I lived in the Hartley neighborhood for several years before purchasing my home in 2016, it was the ability to buy a home in this neighborhood that compelled a sense of ownership, not only of my home, but of my neighborhood, its longevity, and the quality of life for my many neighbors. The Wyuka land that is available has the opportunity of positively transforming the lives of many neighbors through ownership, as my life was transformed, but only if it is utilized thoughtfully. I do not believe the current project achieves the same, and I respectfully ask that the City Council members empathetically listen to our many concerns and consider reducing the project's density to a more sustainable number. A lesser density has the ability to foster community confidence and responsibility while giving economic hope to the Hartley neighborhood as a whole by way of ownership options for any proposed housing projects on this parcel of land. Thank you very much for your time. It's greatly appreciated.
Yeah, thank you for coming down.
Thank you. Up next is Thomas McChristian. Then we have Paula Ray.
My name is Thomas McChristian. I live at 325 North 34th Street. My wife and I and my sons have been residents of the Hartley neighborhood since 1993. We bought an old rental house and fixed it up. We, put a considerable amount of money into it. My basic concern, or my basic thrust for this evening is to talk about the relationship that I've noticed between the Hartley neighborhood and the city council building. A few years ago, and a few years, like 5 or maybe a little more years ago, there was a derelict house in the neighborhood at 33rd and 34th and R Street on the northeast corner. Residents were getting really irritated with the slow, steady progress of the deteriorating property, and many complaints were made. So finally, Mayor Beitler, and that kind of tells you how long ago this was, and several heads of the different sections from the city county building came out and addressed a rather angry neighborhood and our concerns with that property. They did a fantastic job in terms of discussing the issues, hearing us out, and so, you know, the city helped the property owner see the wisdom in, if he was not going to care for the property, to sell it off and let somebody else, well, in this case, develop it, because it was turned into a duplex. It was added on and it was made into a duplex, which was great. And it reduced the population of raccoons and possums at the corner of 34th and R Street, which for a number of years, that had been the only residence of that domicile. During that meeting with the mayor and the heads of the various sections of the city county building, I was talking to one of the heads, and he just said, well, why are you living in a neighborhood like this? And that really was a gut punch to me, because it was like, that to me demonstrated a huge disconnect with the city county building and the Hartley neighborhood. My wife and I enjoy the neighborhood. I've enjoyed fixing up the house, much to my wife's chagrin. But, you know, the Hartley neighborhood is, as you've heard, an economically diverse and a culturally diverse community. And slowly over time, more and more single families have been buying up rental property and converting them back to the single family houses that they used to be, which is great. You know, we've been doing it, my wife and I have been doing it for close to 30 years. We're like, whoo, great looking house. You know, we went from the worst looking house to the one of the nicer looking houses, but you know, the dual-edged sword is, you know, then we get the increase in our property evaluation. So, you know, not that I'm really complaining about that too much. Mm-hmm. But nevertheless, this proposed project is yet another gut punch to the Hartley neighborhood. We're not, like you've heard from Mr. Rodriguez and others, you know, we're not against developing the area. But we are against the disingenuous language that's being used to try and push this through very quickly, because it will increase population density, it will increase a mono-economic ecosystem in the neighborhood that has been, up till now, has been changing to a mixed economic density neighborhood. It will increase the traffic density, even with 17% fewer renters, as was stated earlier, not having cars, that still means that roughly 80 will. So that will increase density, and yay, great, we've got a Starbucks at 33rd and O Street, but we also have a big problem with people cutting between Vine and O Street very quickly to bypass the stoplights and also to get to Starbucks or get out of the line from Starbucks as quickly as they can. So, the speed at which traffic flows on 34th and 35th Street, as well as the foreseeable density increase of traffic as a result of this project, I think merits stronger consideration and closer looking at by the council. Thank you very much.
Thank you.
Up next is Paula Ray. Then we have Richard Sutton.
Thank you. It's a pleasure to have the opportunity to, as a citizen of Lincoln, to express my thoughts here. I live at 2820 Ryan Street, which is not in the Hartley neighborhood, and I'm here, though, in support of the Hartley Association's position. My reasoning behind that is, as a retired neuropsychologist here in town, I have more time, and I spend my free time volunteering at the Gatehouse. So I've seen a lot of traffic. And I go home and I say, you know, boy, that's a real congested area. When I try to leave or get in there, I'm weaving all over the place. And I moved to Lincoln in 2006 because my daughter and son-in-law started having grandchildren. So my investment in Lincoln isn't for myself personally, it's for the future and for children and the community of Lincoln. I love Lincoln. And my daughter worked for the Historical Society for a long time. So before I even moved here, I knew the history of Wyuka and what a gem it was. So when I moved here, I would go to plays there at Wyuka. I would walk. I'd hear people talk about seeing eagles and birds and just this wonderful conservation area. Yes, it was a mess and it was overgrown, but boy, what a rich, diverse community. So since I've lived here, and now, as I said, I volunteer at the Gatehouse. I go and I clean their boxes. I go over there. I love that area. It is a gem. And I think that some of the thoughts that are being expressed here really need to be taken into account. I admire and appreciate the levity and the weight of the decision that you all have to make on this, because you are setting a future plan. The density here, the questions that it raises for me are, well, traffic, but how about then the people that have to walk? If they don't have cars, not only a traffic problem, they're walking in highly congested areas to get places. That's a safety risk. And when we talk about children, I was pleased to hear that there's going to be a playground. Children need open space, they need air. That little gem right there can provide so much if developed well. If it's overdone, all it's going to do is just be another congested area that reduces the quality and the well-being of a beautiful community. I just want to compliment really the work that's gone into the planning so far. I feel I'm nervous here talking, so I'm getting choked up. But the planning is so impressive, and the work and the heartfelt, genuine concern to develop affordable housing in Lincoln is such a goal and such a wonderful aspirational direction to take. And I just hope that this body will take the time now to consider these other factors and listen to this community that is really bringing forward how you can have both, move forward and yet preserve a gem. It's a real gem over there. So I want to thank you all. And
thank you for coming down.
Up next is Richard Sutton. Then we have Nancy Burt.
Hello, my name is Richard Sutton. I live at 3845 Apple Street in Lincoln. I'm a professional landscape architect, and I'm a member of the board for this Wyuka Historical Foundation. The comments I'm making tonight, however, are my own, alone, and do not necessarily reflect those of the Wyuka Historical Foundation board. I have a hearing disability, so I won't be able to answer any questions afterwards, but I've got my email contact there. Most of what I have tonight are questions. I don't really have answers. I'm asking a bunch of questions about the development process in general and about the details of the site plan that's been submitted. I would suggest you can probably get those answers from city staff or from the site engineer. The City of Lincoln must perform due diligence on proposed zoning changes and development projects to assure they meet design criteria and standards in our city ordinances and development codes. And that's one of the reasons we're here tonight. It's understandable that this is a rolling process and plans become more detailed as they near the approval for zone change or building and grading permits. However, Wayuka Cemetery is kind of a special situation. Development is being proposed adjacent to a National Historical Registry property in which the landscape has been deemed as special. Other landscapes in Lincoln so designated are the State Capitol grounds and Pioneers Park. In this case, at Wayuka, and in the future, maybe the city could take a little bit more time and study in more detail impacts on National Registry properties, as opposed to just the typical development process and hearings. Perhaps this developer, Mr. Hoppy, and other developers in the future might host open houses and solicit concerns before getting this far into the development stream. Okay, the rest of my presentation is going to consist of questions in 4 specific areas: views, grading, paths, and then circulation and parking. Views of the project from the surroundings, especially from the Wayuka side looking at the Gatehouse project. A drainage swale that separates the proposed project from Wayuka has a number of intermittent groupings of very old evergreens. They're very large. Their root zones must be protected during any construction, or they're going to suffer. Because older trees' roots can be impacted, no disturbance boundary zones will need to be put out to protect the trees beyond their canopy spread. The city requires that different development proposals such as this include existing trees to be shown on the grading plan. We had a problem 30 or 40 years ago in Lincoln where developers would buy property and then they rush out and they would knock everything down, and then they would go ahead and develop it and bring the plans into the city. And people got a little upset with that. So the city is requiring that existing trees be shown on the plans. Unfortunately, in this case, there's one glaring omission. We have a very large spruce, which I think could be the largest in Lincoln, has been left off. And it sits right adjacent to the northeast corner of a proposed Building 2. And I'm very concerned that development that close to that tree will have a detrimental impact on it. Where gaps occur in the evergreen screen along the drainage separating the project from Wayuka, it will be necessary for the developer to include and show placement of large evergreens whose location is coordinated with Wayuka's restoration of the drainage swale. Our understanding of views and building heights would have really been helped if we'd had cross sections. We had some elevations that were shown. Those are nice to show relationships within the project. They do nothing to show us what happens within the cemetery and with adjacent property across 36th Street. None, as I said, none seem to be included with the plans that I reviewed. Likewise, residential neighbors to the west might like to see what those cross sections show of the relationship of 35-foot high buildings to the site and the surroundings. Next section, grading, drainage, and erosion. The grading plan submitted with the proposal is hard to read. For example, no existing contours are numbered. So it's difficult to understand how much cutting and filling takes place in any particular part. Perhaps building number one's finished floor elevation might be dropped a foot or two, but we don't really know because we don't, oh, sorry. I got a minute. Could I ask for a couple more minutes? I know you guys have had a long evening. All right, I tell you what, I will cut 2 minutes and I will cut to the chase on some of these others. I also have, by the way, copies of this that I can share with the council. Many of the slopes that are shown on the plan are 3 to 4 or 3 to 1 or 4 to 1. Those are unmowable. It'd be nice to know what's going to be there for landscaping. They certainly are going to be unusable by people from those units. I've got a concern about erosion. The velocity of the water coming out of the detention ponds exceeds 5 feet per second on the 2-year and the 10-year storm on Pond A, and on the 10-year storm and 100-year storm on Pond B. That means that there's going to be erosion where those things are let out. There's also some problems with grading between the buildings 4A through D. Seems to be a problem with water running against the north slope or the north elevations of the building. There's a community garden proposed, but I don't see how the residents are going to get to it. There's no walkway or bridge or any way across it. Finally, 4 substandard dead-end mousetrap parking lots. And I'm surprised this made it through the review by Public Works. Also, 400 feet from S Street to the end of the parking lot. How is the fire truck going to get back there and turn around? I hope the plans are not to make S Street into an emergency exit. So those are my main concerns, and I will share these in writing with the council members. Thank you.
Up next, we have Nancy Burt, and after that, Anna Graff.
Thank you. My name's Nancy Bird. I live on 625 North 35th Street, so I'm about a block west of Wyuka. And I cut through the alley to get into Wyuka, where there's been a hole in the fence for 30 years, where all the neighbors go through. I've raised a family in this area. I've gone through 3 sets of dogs who've died at very old ages that I've walked in this park. Wyuka to me is our, like Central Park is to New York. It's also the wild space that they want to build on is kind of like the neighborhood wilderness park. It's where we all go. It's a green space. I go there, I see fox. Fox raise their young in this area. There's owls that hunt here. There's plenty of wildlife to feed these guys. So, and when I moved here 30 years ago, up until now, I had no idea that all this land was not future grave space. I figured I would always have Wyuka there. It would always be our little country, kind of like we moved on the edge of town forever. Some of this land has probably never had a spade put in it before. It could be virgin prairie as well. So I see this area as a wildlife corridor. It's a place for the kids to go play where it's not all structured and playground equipment. It's hills and trees and places that kids can play on. It's places where kids go to learn how to ride their bikes. It's a place where people take their kids to learn how to drive. I mean, it's just a gem to our city. And I think that I had no idea that that wasn't just future grave spaces that was in this buffer here all this time. And so I'm fully against developing this into anything but more of a park to make this part of our green space in a city that is, getting way too congested, as it already is. So I'm fully against building anything there. A few little small, tiny houses might be okay, but I'm also very much against putting everybody who is low income in one space. We have apartment buildings going up all over this city. Why aren't there designated a certain number of apartments in every apartment building that goes up to be for affordable housing? Why are we going to put all the poor people right here? Put them up against the cemetery. It's wrong. It's a wrong way to treat humanity. And we all need green space to be healthy. And so I'm just full on against hurrying through, voting tonight instead of waiting until Friday, and all the waivers we want. It's not considering the people that already live there. The green space is important for the health of all of us, for our children. And also, I live on 1 block from Hartley School. And so we've got a school there, and people fly through our alley all the time to get their kids to Hartley on time. And then they fly back when they get them done. We're the ones that have to buy the rock and fix the alley and put up signs that say, slow down, you'll kill any children or anything like that. So it would add a whole lot more people to a neighborhood that is 35th Street. People just fly down it. And so I really hope you will consider the neighborhood, the impact that it gives a very historical neighborhood.
Okay. Yes, Mr. Schob.
Hi, thanks for coming forward. You said something in passing, and I wasn't sure I understood you correctly. You were talking about the green space and the foxes and the park, and you said people learn to drive in this area.
People what?
Learn to drive, and I was thinking, they're driving in the green space?
Oh, no.
I was a little confused. Wait,
Cemetery, no.
Cemetery. Yeah, the cemetery will stay, right? We're not going to change it.
The cemetery will stay.
So they'll still learn to drive there, okay.
But,
misunderstood.
But all the people that have lived in this neighborhood have never expected their view to go from trees and wildlife and the cemetery, which we adore in this town, to buildings.
You went from biking and the green space to driving, and I thought, wait, people are driving there today? That's what, yeah.
Okay. Thank you.
No, thank you.
Up next is Anna Graff. Then we have Sue Berkey.
Which one?
Hey, either one.
Okay.
Pick Sophie's choice.
Hi, my name is Anna Graff, and I live at 433 South 18th Street. I am representing the views of Renters Together, a group in Lincoln who advocate for affordable housing. We strongly support this development with 98 units. Lincoln desperately needs affordable rental housing that is connected to transportation and located near grocery stores. This project does that. It has the potential to decrease racial inequality in Lincoln and make the city more sustainable. First of all, as you all hopefully know, there is an affordable housing crisis in Lincoln. According to numbers from the city's Affordable Housing Coordinated Action Plan, 45% of renters in the city are cost burdened, paying more than 30% of their incomes towards rent and utilities. This percentage has been growing over the past few decades. The plan also states that Lincoln needs 5,000 new affordable housing units in the next 10 years. This project would build some of that affordable housing. Transportation needs to be considered for all developments, but especially affordable housing. Affordable housing that is far away from schools, places of employment, and affordable transit options, such as what can happen when affordable housing is built on the outskirts of the city, can often lead to unaffordable transportation costs and a lose-lose situation. Low-income households, on average, spend more of their budget on transportation, and so fortunately, this development is located near multiple transit options. It's close to 2 bus lines, 44 and 49, as well as being near the Mopac Trail, all of which provide affordable transportation for residents and connect them with other parts of Lincoln, especially grocery stores. There are many nearby at 48th and O, including Hy-Vee, Super Saver, and Natural Grocers. A lack of access to grocery stores is something that a lot of other affordable housing in our city is missing. I have lived in Lincoln for 6 years and never had a car. It is not the easiest thing, and we should invest more in public transportation, but lots of people here bike and walk and use public transportation to get around. It works. The concerns about increased traffic are unlikely to happen to the extent being discussed. People who are low income, who would be eligible to live in this affordable housing, are significantly less likely to rely on cars for transportation or own them at all. that this development would be so connected to public transit and active transportation options is vital to ensure people are able to get around Lincoln, but it also means people wouldn't need to rely on cars. We need dense housing in Lincoln in all different neighborhoods. Denser developments are more efficient, with lower costs of operating transportation and other forms of infrastructure. As neighborhoods become more dense, the average vehicle miles traveled per household tends to decrease. Time spent in traffic can actually decrease with increased density. People can walk and bike to get around, as opposed to often needing a car to get around areas with single-family homes. Denser areas are more vibrant and environmentally sustainable due to supporting public and active transportation. They also have lower emissions. Research has also found that denser neighborhoods tend to be cooler in the summer as compared to suburban areas. This is only going to be more important as the climate crisis continues and Nebraska is warmer year after year. This has a dramatic effect on older adults for whom high temperatures can be deadly. Ultimately, arguing against density means keeping things the same and perpetuating segregation. Single-family zoning with very low density has been used to create and perpetuate racial segregation. Redlining happened in this area of Lincoln. Black residents and other residents of color were not allowed to live in this area. The wealth that white families have been building through housing was denied to people of color. Denying dense, affordable housing is perpetuating racial inequality. That segregation is part of the reason why affordable housing is needed in Lincoln. Redlining and other forms of systemic racism has led to families of color being more likely to be low income and harmed by Lincoln's lack of affordable housing. The Lincoln-Lancaster County Board of Health declared racism a public health crisis in Lincoln. One way that racism strongly impacts health is through housing. Evictions and struggling to pay for or find affordable housing are associated with worse mental and physical health outcomes, or it can lead to families struggling to leave housing with mold or other factors that negatively impact their health. Building affordable rental housing is important, as there are many reasons why renting might be the best option for a household, from financial to other practical considerations. Ensuring that we are investing in affordable rentals, as opposed to solely homeownership, will help people have the options to do what's best for them and their families. Almost no one says they are against affordable housing. They simply say, not here and not like that. But dense housing is the only way to build the affordable housing our city needs. Concerns about traffic can be addressed in combination with increasing public and active transportation that would benefit the residents who already live there. Concerns about green space are also valid, but it would be really different if we were talking about building luxury housing. We're not. We're talking about building affordable housing for people.
Can you wrap it up?
Okay. There's a lot of work to do to ensure everyone in Lincoln has access to affordable housing. This development is an important step in that direction and an opportunity for the city to work towards the goals it has said are necessary.
Thank you. Any questions? No, thank you.
Up next is Sue Berkey. Then we have Robert Mertz.
Hello.
Hi.
My name is Sue Berkey, and I live at the corner of 36th and Q with my 87-year-old father. I'd like to thank the council for giving me and us an opportunity to speak to you today. I fully support our city's goals of providing affordable housing in Lincoln, and I understand that the need is critical right now. The Gatehouse Row Wyuka apartment complex proposal, as it currently stands, is not a viable way to achieve those goals. The Hoppy plan is simply too dense for this site. Far too dense. The Hartley neighborhood is already one of the most densely populated, racially and ethnically diverse, and lowest income neighborhoods in the city of Lincoln. The narrow strip of buildable land on the proposed site simply cannot support this many units. The proposed density of 98 units, or alternatively 80 units as suggested by the planning staff, is just far too much for that site. Part of the proposal, the builders have requested zoning changes as well as numerous waivers. Included in these waivers is a change in the required parking from 2 stalls per unit to 1.4. Not only would this force the residents to use on-street parking for some of their personal vehicles, but it would guarantee any visitor parking be relegated to an already crowded adjacent street. I have concerns that this waiver would send the message that 2 parking stalls is what we need to supply to new housing, unless it's low-income housing. And then they don't deserve the dignity to have a safe place to park their vehicles. I just don't like that message. Increased traffic would inevitably reduce the safety of the neighborhood streets and increase congestion. Watching our neighbors have to navigate through this winter's snowy conditions with a great number of streets remaining impassable for days at a time has highlighted how ill-equipped the infrastructure is to handle 700 or 800 additional trips that would be generated by this proposal. A requested waiver for reduced setbacks, as well as the planned 3-story nature of the apartments, will completely cut off any visual or meaningful access to the green space of Wyuka. The potential damage to the historic site, as well as the negative impact on its connection to the neighborhood, would be a true loss for us. I'm also concerned about the lack of affordable ownership options being offered in this proposal. A path to home ownership is a powerful tool to a lower income individual or family. And I think that this would be an excellent site for such properties to be integrated into. The addition of some lease-to-own properties, such as the Crown program, which is detailed on the Hoppy Homes website, would be an ideal way to enhance both the neighborhood and the city's goals of serving its lower income individuals. Over the past months, I have heard from many passionate neighbors, and the opposition to the current proposal has been universal. This site cannot support 98 units. It cannot support 80 units. But with appropriate changes, it could potentially support a reduced number of rental and or lease-to-own properties that could respect the current character of the neighborhood, address resident concerns, support the mission of the city of Lincoln, and serve our lower income community in a lasting and substantive way. The parcel of land under consideration has been described as unique, as is the opportunity to utilize it to further our goal to better serve some of our more vulnerable community members. We can and we must do better than this. I say let's go back to the drawing board and find a solution that does not cause more problems than it solves. Thank you for your time.
Thank you for coming down.
Up next is Robert Mertz. Then we'll have Kurt Donaldson.
My name is Robert Mertz. I live at 3511 T Street. I'm right on the edge of Wyuka. It's a dead-end street. It says so right at the top of the hill. I don't want to be redundant. Everything has been pretty much stated here. But all I want to say is they're trying to put 10 pounds of BS into a 5-pound bucket. And I thank you for your time.
Thank you.
My initials.
Up next, Kurt Donaldson, then Candace Beck.
Good evening, Mr. Donaldson.
Hello, I thought I'd have more time. Interestingly enough, I'm the one, when I was on the council, that suggested the 1-minute warning, so I shall not ask for extra time. Cut me off, you know. Had a lot of good material, cut a lot out, so if I lose my place, it's because I'm trying to help out everybody. I think I'd like to summarize, to cut to the chase, to characterize this Wyuka project and to squeeze it all into one sentence. As far as the neighborhood sees it, that Gatehouse Row fits better into the city's need for affordable housing than it fits into the neighborhood. And this is a position of a neighborhood organization. And neighborhood organizations, I've done a lot of thinking about this and have come to realize that we are not very representative of our neighborhoods. Because when you take a neighborhood like Hartley with 1,500 housing units, and you leaf the neighborhood and it's 2/3 rental properties, you leave the neighborhood for an annual meeting, you get 35 people to come to the annual meeting if you're lucky, and they'll be pretty much all homeowners. So the interests of a neighborhood association represent homeowners. That's just the way it is, and I think that's what you've heard tonight. So, you know, that's who we are. I don't feel comfortable here at all arguing against an affordable housing project. So I won't, because I know how these things go. The council listens, and you do your best, and you do what's right for the community as a whole. You try to accommodate everyone, but when the developer of this project says it's 98 or nothing, and you all support affordable housing, well, I'm not dying of suspense as to how this is going to turn out. Spoiler alert. But what I would like to comment on in my remaining time, I'll need to move along here, is where this really fits in to the bigger picture. Is it really useful as a template? Is it really scalable? Can we do 500 units of direct affordable construction per year as infill in older neighborhoods? The council will need to approve a project this size just about every other month. And you've heard that the number is 100. And that means you'll need to be finding 40 acres a year to put them on. I don't think it's going to happen, whether I supported it or not. I don't think it's too likely. So I'd like to talk about a couple of other things and to look at the really big picture. The question is, what else can be done? Well, one thing is, if people had more money, they could spend a smaller percentage on housing. I think that's true, and I think the usual response to that would be, well, duh. But last week, the U.S. Congress said, here's a bunch more money for people, even poor people. It is a revolutionary event, the passage of this law. And I will tell you, I think this money will do more for housing affordability in Lincoln and across the country than something any earthbound council can ever dream of that needs to actually balance a budget. So I'm optimistic about that. But I think there still is a vital role for city government to increase the supply of affordable housing. But I think the most practical way to do this at scale may be the indirect approach of doing everything possible to increase the supply of market rate lots and housing, both homes and apartments. I think you heard the same thing a couple of weeks ago from the home builders and the Board of Realtors, and strange bedfellows, but been there before. So I think we will continue to get most of our affordable housing in Lincoln the same way we've been getting affordable cars. And that's, some people have enough money to squander money on new cars, and then they trade in their used cars, and that's how we get our affordable transportation. And I think that's really how we're going to get along, because the problem is bigger than the solution that's been proposed here today. Very briefly, this is a bonus paragraph here. The question is, in the future, can Congress really just continue to send people money? Well, perhaps we have reached a new understanding in America between the rich, the middle class, and the poor. There is unequal income distribution. The rich are able to resist paying more taxes, but they are willing to lend their money and, in fact, need to. Oh, well.
You can keep going.
Okay,
I want to hear the end.
Finish the sentence,
You
please.
got to finish it.
All right. To lend their money and, in fact, need to. They will lend the government money to send to poor people or anyone as long as they're paid back, and the government can just borrow more to pay them. The supply of dollars can be increased to meet the demand. as a local micro tycoon myself, I will take, and a provider of affordable housing, I will take the money and pay my bills. Well, enough for today. Thanks for your attention.
Thank you, Mr. Donaldson. Any questions? Guess not.
Covered it. Thanks for your email today.
Up next is Candace Beck. That is the last name I have on the sheet.
Good evening, everyone. My name is Candace Beck, and my address is 307 North 36th Street, which is directly across the street from this proposed development, which I am strongly opposed. I think the Hartley Neighborhood Association and the members of the neighborhood have done a wonderful job speaking tonight in behalf of our concerns, which include just density, parking concerns, safety concerns, and traffic. So because of how late it is, I won't go into further detail regarding those issues. I just wanted to come tonight to be another face representing the neighborhood and our opposing viewpoints, and just to reiterate how this dense of a project would negatively impact the quality of life for the Hartley residents. If the density is reduced to 54 units, the density supported by Hartley Neighborhood Association, then no special waivers for setbacks would be required. The character of the neighborhood is maintained. Parking and traffic concerns would be proportionately reduced, and the city would be 54 units closer to their goal of 5,000 affordable housing units. Thank you so much for your consideration in this matter.
Thank you for coming down. Is there anybody else that'd like to come forward at this time? Would the applicant like to do any rebuttal?
I was running from the back room. Somebody left their mask. Just a couple things I'd like to mention. There was a lot of discussion about the waivers. We included the height waiver really at our request. The architect tells us we don't need it, and it was only for 2 feet. It's until the finished floor elevations are determined, but it's likely it's not going to be needed. The rear yard waiver is kind of a misnomer because we're creating an outlot adjacent to the drainage channel, and the buildings are going to be 15 feet from the edge of the outlot, and the two outlots are combined about 50 feet, so actually the dwelling units are going to be 65 feet from Wyuka on the east side of the channel. It's hard to tell that from looking at the site plan, looking from the map, but that's really how it will be platted. And so the rear yard waiver is kind of a misnomer because of the existence of the outlot. We wanted to put the ownership of the creek bed into the outlot really for maintenance purposes. This is a primary issue. So I wanted to address that one. There was some discussion about the CUP. All I can tell you is that we use the calculations and the formulas required under the code and the design standards to determine the density allowable under the R4 zone. And the CUP design standards, you have to look at the entirety of the site. That's how we always examine CUP. That's what the code requires to examine community unit plans and the density that is permitted. And that's what was done here. There was some mention too of other financing options of a smaller project. I can tell you that's not on our radar. Nebraska Investment Finance Authority application process is an annual process, and you have to be ready to go when the deadline's scheduled. The deadline that is scheduled for the tax-exempt bond is this coming Friday. The schedule for the 9% tax credits is in October of each year. So that at a minimum, if the council would choose that we should scale down the project, we'd probably look for a different site because that is not possible for this project. For this project to move forward, we need the density, and it is still, as I mentioned before, lower than the permitted density under the existing code and the existing design standard. And I'd be happy to try to answer any questions that you may have.
Do we have any questions for Mr. Houston? Yes. Councilman Bowers.
I just had 2 questions, and this might be a question for you, this might be a question for David Carey. Can you speak a little to the concern about building on the 8 acres? We've heard a lot from folks saying that they had concerns that it's not truly 8 acres. Can you speak to that a little bit?
Well, that's what I was trying to refer to, the purchase agreement that is executed with the board of directors of Wyuka Cemetery, which is, as I mentioned, is the Nebraska nonprofit corporation. It's a public corporation, but a nonprofit corporation. Really tries to describe the center line of the creek bed as the boundary line, and we will have to replat this property. It will, I think it will be replatted. But the 8 acres is measured in the totality of all the property that's being acquired. Originally, there was some property located on the east side of the channel that was really going to be designated for the detention area. That's what our plan was. Our civil engineer tells us it won't work at that site, so we had to bring the detention cell back to the west side of the channel. But it's still part of the acquisition from Wyuka Cemetery. So the 8.72 acres is the entirety of the area, and it does include the roughly third of an acre that's being acquired of the Gatehouse, the property owners that own the house at 3600 R Street, which was the former caretaker property. That's included in our package to preserve that historical nature of the home and keep it as a community center clubhouse type of facility for the development.
Thank you. And then my second question is about traffic. It seems like the 3 areas concerned are density, parking, and traffic. And my question with traffic is, can you talk a little bit about the traffic study that was completed and kind of walk through the process of how a traffic study is done and how those dates and times are picked?
Well, yeah, and
Quote the start of the executive summary.
yeah, we engaged the traffic engineer to examine this back in, I think in December. And the executive summary from the traffic study, I'll read it. It says the multifamily development scenario compared to a single-family development scenario would be anticipated to increase peak traffic volumes in the AM peak hour by 28 vehicles and 32 vehicles in the PM peak hour. The denser multifamily development scenario would increase peak traffic volumes by 8 vehicle trips in the AM and 10 vehicle trips in the PM. So what he's saying there, comparing this multifamily to single-family development, has that type of incremental traffic generation. And I know that, I heard the comment that perhaps the counts were skewed because they were taken in December during a pandemic when there was less traffic. I think that's part to see the existing traffic, but I can tell you the projected traffic was based upon the unit count and the bedroom count of the proposed project to generate the anticipated traffic generated by the project in the future.
Thank you. That answers my questions.
Any other questions? Yes, Councilperson Washington.
Thank you, Mr. Chairman. Mr. Houston, would you please answer the question? I think one of the folks who came up had a question about T Street and about emergency vehicles.
Yeah, that was one of the items that was examined, whether to have access to the parking lot from T Street. We determined no, not to do that. One of the things that we're still examining, I think it still can be used for emergency access, but we have to be very careful in how we do it because we don't want any daily traffic into the parking lots on T Street. One of the things that we're looking at is perhaps some permeable pavement there, or some of the pavers underneath, the grass that could be created there, so it could support the weight of a fire truck, but not. We don't want it to use it on a daily basis. We thought that was too much north and incursion into the neighborhood to be using T Street. But I know what he's talking about. That T Street does dead end at the really western edge of this property, and we were trying to not use that as an access point.
Thank you.
I guess the last thing I would say is that obviously we've seen multiple circumstances in the city of Lincoln over the last 25 years where we've had new multifamily development being built in an existing neighborhood, and it's always a tough item for the existing neighbors. It's going to be a change, and I understand that. I think history has borne out that it's not as adverse as most people had anticipated, and I think that will be true with this project. We think it's going to be a high-class design, it's going to be very good quality materials, it's going to be monitored closely, and we think it'll be a great addition to the city of Lincoln.
Yes, Councilperson Show.
Thank you, Mr. Chair. Mr. Houston, just 2 quick questions. Many of the people that came forward and asked questions heard the development's affordable housing and heard low-income housing. How often do you hear those things used interchangeably, and is that fair?
Well, I think it's fair, because this project, if approved, will use 2 financing tools. One is the low-income housing tax credit. The other is the Nebraska Affordable Housing Tax Credit. And they're both, I mean, the terms are somewhat interchangeable in the tax credit world. But it is really designed to be workforce housing. It's designed for the family of four that both mom and dad are working. And one of the beauties of the site that I forgot to mention, it's in walking distance to an elementary school without crossing Arterial Street. That's hard to find in an infill lot, infill property. But I think it's fair that those two terms are interchangeable.
And the second question is, there were several people that were concerned about this would change the character of Wyuka as a park. And so how did you come to this arrangement with Wyuka?
Well, we have an option to acquire from Wyuka, and Wyuka approved the design, and Wyuka approved the project as a part of the negotiation of the contract. And I guess we took a lot of solace in the presentation to the Historic Preservation Commission, which found specifically to the contrary that this would not have any adverse impact on the historical site that Wyuka is under our code. That's the only answer I think I can give you.
The history question is what I was looking for. I didn't ask my question very well.
And frankly, it's west of the channel. It's west of the channel, which is just unused by Wyuka.
Thank you. Thank you, Mr. Chair.
Okay.
Thank
Any
you.
other questions for council?
Thank you.
Okay, seeing none. That will end our public hearing on that item.
Did you have any staff questions? Those guys are like they're.
Do we have any staff questions?
Yeah, I didn't. They're excited to talk about something.
No, Councilman Shob asked the question I was going to ask of Mr. Carey.
Okay.
Good, yes, good.
Okay. Seeing none. That ends our public hearing for those.
All right, we can move on to the ordinances, third reading, and related resolutions. Item 6A.
Well,
Yes,
We have to
Councilperson
suspend the rules and vote?
Christensen.
as I'm fairly reluctant to do this, but I'm going to move we suspend the rules to vote on these issues now to allow this project to move forward with a higher degree of certainty.
Second.
Okay. It's been moved and seconded by Councilperson Raybold that we suspend the rules to vote on this evening. Is there any discussion on that? Okay. Let's call, yes, Councilman Show.
So, this is on second reading. We've had a public hearing. Suspending the rules doesn't prevent anybody from testifying or giving an opportunity to speak on it. Is that fair to say?
No, not publicly.
Okay. That's been the charge against us in the past when we suspended the rules.
So we've had the public hearing.
And, Mr. Chairman,
Mhm.
just as a second reply to Councilman Shob, we have two resolutions and one ordinance. And resolutions typically get voted on
On second reading.
on second reading. So it's the ordinance that we would be really waiving rules on.
Correct.
And everyone has spoken. We have received a lot of
Several-
phone calls,
Several contacts.
several contacts. Yeah. all right.
Thank you.
Okay. Any other comments? Let's vote on suspension of the rules.
Is this suspending the rules specifically just for the ordinance or for all three?
For all three, because we had them on for the next meeting.
Okay. Washington?
Yes.
Raybold?
Yes.
Bowers?
Yes.
Shob?
Yes.
Ward?
Yes.
Christensen?
Yes.
McGinnis?
Yes.
Motion carried 7-0.
Now we can vote on each one individually.
Item 5A is the Comprehensive Plan Conformance 21001, application of the Urban Development Director to review as to conformance with the 2040 Lincoln-Lancaster County Comprehensive Plan, the Wyuka Redevelopment Plan, including the Gatehouse Row redevelopment project generally located at 3600 R Street, introduced by Bowers.
So moved.
Second?
And moved and second by Councilperson Raybold. This is voting on the comp plan amendment. Any other questions or comments? Yes, Councilperson Rabel.
Well, I'm going to, all these remarks refer to all three items, so I'm just going to get them out. And then maybe we can discuss it in more detail. I really want to assure the crowd that I did take the time to participate in one of the Neighbor Works meeting. I also took the time to talk to Mark Hunsinger, your attorney, and he also suggested that I take a look at the Clinton and Hartley Neighborhood Housing Connection, a study of housing opportunities and solutions, which I did, and I read the entire report on Sunday. It was done in 2015, and it raised a number of really very interesting and very important parts. It certainly recognized the vitality and diversity of Hartley neighborhood and the Clinton neighborhood. And not to reference a blight study, but it did make a number of recommendations for the single-family homes in addition to future projects in that neighborhood. So the need for new housing development along with the rehabilitation or preservation of existing housing is important for Clinton and Hartley neighborhoods. And in particular, they looked at the Hartley neighborhood and they did a field survey, and they determined about 457 of the existing housing units needed some help. They singled out 262 in need of moderate rehabilitation, 195 in need of substantial rehabilitation, and a recommendation that 50 units should be demolished. But most importantly, I think about what the study showed was that there has been intentional planning in this location for housing in the Wyuka area, and not only in this area, but also along Vine Street for more housing. And in the initial summary, it was proposing just in the same geographic area that the Hoppy project is proposed. They recommended Area A, Area B, and Area C. And I'm sorry to take so much time to explain it, but I think it's important what they were suggesting about what should go in this very location. In Area A, they talked about duplex rental housing development, and they recommended 10 units. 10 units of 2 and 3 bedroom units. In Area B, they recommended senior rental townhouse building units of 16 units of 2 bedrooms. And then in Area C, elderly duplex, triplex rental housing with 32 units of either 2 or 3 bedroom units. And the reason why I spent some time and I was trying to figure out, okay, what is the common denominator? The common denominator of what the recommended from this study was 58 units, and we've talked about 58 units tonight. So 58 units, and then I further dug into it and tried to calculate, okay, how many were 2 bedroom, how many were 2 bedroom, how many were 3 bedroom and single bedroom units. And surprisingly, when you look at it from that perspective of how many bedrooms are you creating, with the Hoppy project, they had 98 units. But they were proposing 46 1-bedroom, 48 2-bedroom, and 4 3-bedroom. So it gave a total of, Mr. Houston said, 154 beds. But when you work at the project that was recommended in the study done in 2015, the 58 units, and you did the same calculation for beds, it came up to 140 beds. So we're talking about a difference of 14 beds in the study that was recommended for here. Along Vine Street, they also recommended another multifamily housing project of 140 units from this very study. How do we create this housing that we all recognize? And there are some other really great things that were in this study that jumped out at me. It's looking for redevelopment boosts to handle above standard trend. And when I looked at the design elements, and I know we have architects that are very sensitive about it, I thought, what a lovely looking exterior facade of how it could fit in better to this beautiful neighborhood. And I know this neighborhood because I often ride my bike to work on the Mopac Trail, and my office is on W Street, just 1 block south of Vine. The study also recognized that automobile traffic will continue to be an issue in all these neighborhoods, in the Hartley neighborhood, Clinton, and on 27th Street. It continued to say O Street, 33rd, 48th, and Vine are going to be the primary conduits and corridors. But then also in the study, it talked about the age groups that are the primary residents in Hartley and Clinton. And surprisingly, what I thought was really just jumped out in a total contradiction in the report is that it talked about the age groups for the next 10 years, 2015 to 2025, and it said they need to focus on students on East Campus and singles and couples. And it said no population increases are projected for the 75 to 84 age group, which I thought that was a total contradiction because the housing units that were called out here really targeted seniors. But it said in the Clinton, the Hartley neighborhood population is largely represented by 19 and under, 20 to 34, and 35 to 54 age group. And when I saw the Hartley neighborhood, I mean, it is such a beautiful study in new urbanism where you have that wonderful transition of people that have the aspiration to be homeowners. You have rental units, then across the street you have the duplexes, and then you have some beautiful single-family homes and you can see that restoration is taking place. And so that creates that beautiful microcosm of what we're trying to create. And I think Mr. Houston said it very clearly. It's such a rarity to be able to have your children walk to their public school. And that's what makes such a beautiful and complete neighborhood. And I know I don't live there, but I work close there. And I see that this is something that really would enhance your neighborhood and not be a detraction to your neighborhood. And I think when you look at the sheer numbers in the comparison that I did, it's 14 beds more than what was currently proposed back in 2015. So for these reasons, I am going to support this. And I do appreciate the beauty that Wyuka brings to everyone who lives around it and near it. And I think this is going to be something very good for the neighborhood.
Okay.
Sorry to take so long, too, but it was a great report, and if you haven't read it, you should all read it.
Any other comments on 5A, Comprehensive Plan Amendment? Seeing none, please call the roll.
Washington,
Yes.
Raybold,
Yes.
Bowers,
Yes.
Schob,
Yes.
Ward,
Yes.
Christensen,
Yes.
McGinnis.
Yes.
Motion carried 7-0. 5B is the change of zone 21004, application of Gatehouse Row LP for a change from P Public Use District and R2 Residential District to R4 Residential District on property generally located at 3600 R Street, introduced by Bowers.
So moved.
Second.
Been moved and seconded by Councilperson Christensen. Any other comments or questions? I didn't see our staff here. I had a quick question for them, but wonder if
They're still here.
they're still here.
Mm-hmm.
You think they're listening to us?
Yep.
Yep.
Ah, there he is. Mr. Marvin? Two quick questions. One, if this project doesn't go through, he doesn't get the funding, doesn't get the money from the NIFA, and he doesn't purchase the ground, this ground still becomes R4, correct? We're changing the zone.
Yes, it does.
So it is permanent.
Are changing the zone.
So it is a permanent change of the zone
Yes.
Till we reverse it.
until we come back and reverse it if the project doesn't go through.
You guys are the deciders.
We can't put a condition on it, so. That was my other question is he's looking for TIF, or the developer's looking for TIF?
That's correct.
And there will be a redevelopment
That's correct.
agreement that will come to us at a later date.
We would expect that after this, we would work on a redevelopment agreement. The TIF amount, because this is a tax credit project, will not be huge, but we'll be able to pay for many of the public improvements that have been discussed here tonight.
Okay.
Landscaping, the roads, water mains, the other issues that we would expect to be able to
Okay,
cover
just
that.
checking.
Mr.
Chair, I have an additional zoning question, if Mr. Curie would
Yeah.
yield for a question. We've been down here all night, so we ought to get, you know.
No, I know, we gotta
get
wake you
here
up.
and Get a couple of questions in.
David Carey, Director of the Planning Department.
Thank you, Mr. Carey, for coming forward. Thank you, Mr. Chair, for allowing. So we're rezoning this from public to R, what, 2?
R4.
R4. What other, if this didn't get financed, what other type of developments could go here in the R4? Would we see different types of housing developments here? Would it preempt single family?
Oh, no, it would not. It would, you could have single-family detached, you could have duplexes by right, actually. And then it would just be a basis of how much land area there is. And that's effectively how that 54 number came about, is what we've been discussing as far as a more of a by right opportunity in the R4.
So theoretically, would make it easier to develop for housing in the future, doing this zone change now?
I don't know if it makes it
shave a step
easier.
off the-
It would allow for a little bit more density than what would otherwise be there.
But anyone else that came to develop another project would have to have it changed from public to R something, correct?
Yes, so they were going to use that land for residential, correct?
I appreciate your time. Thank you, Mr. Chair.
Okay. Any other questions? Yes, Councilperson Washington.
I don't have a question, but I think I'd like to speak about the zoning R4. Changing the zone to R4, I believe, makes sense. The adjacent property or adjacent area on the other side of 36 is R4. This is a consistent zoning for this area. I realize that today, the area just on the west side of 36 does not actually feel like R4 because the lots are fairly large. There's space there, but it is still zoned R4, so this is consistent zoning.
Thank you.
Any other questions? Okay, you can call the roll on 5B, right?
Washington,
Yes.
Raybold,
Yes.
Bowers,
Yes.
Schob,
Yes.
Ward,
Yes.
Christensen,
Yes.
McGinnis.
Yes.
Motion carried 7-0.
Okay, 5C.
Next is 5C, the appeal by Tony Rodriguez of Planning Commission approval, special permit 21003 to allow for a community unit plan on property generally located at 3600 R Street, introduced by Bowers.
So moved.
Second.
Been moved and seconded by Councilperson Christensen.
Could we get
Mr.
a
Chair.
clarification
Any
on the
comments?
vote? I always get confused on the appeals.
You vote yes if you want it.
If we-
So you vote no for the appeal or yes?
So
Yes.
what this is what is before you now is a special permit. It has been appealed to you, as is the right of anyone within 14 days of the Planning Commission action. So it's in front of you as if it was just being presented for approval, just like the change of zone that you just acted on. So a yes vote to this is in support of the special permit moving forward, being approved. A no would say you're against the special permit.
Okay.
Got it. Thank you.
Mr. Chair,
Yes.
don't walk away yet. Mr. Chair, may I?
Yes.
So this is being appealed because it came before the Planning Commission. It had a public hearing, it had testimony, evidence was presented, ideas were discussed.
Yes, so some of our items can be final action at the Planning Commission. This would have been one of them, unless appealed. And we have that appeal process in place for the purpose of taking up to the City Council on those types of items that could otherwise be final action at the Planning Commission, and that's what happened here.
Is there anything new that we heard tonight that wasn't presented to the Planning Commission, to your knowledge?
To my knowledge, no, there was nothing new as far as the information that's part of the proposal.
Okay, thank you. Thank you, Mr.
Okay.
Chair.
Councilperson Ward.
Thank you, Mr. Chair. No question for you, Director Carey, but thank you for the clarification. I too always need the clarification. We do these not that often. I just want to comment and thank Mr. Rodriguez for filing the appeal. That I was at the neighborhood meeting when you talked about doing that. I know Councilman Bowers was present as well, and so you don't know unless you try. And so I appreciate all that the neighborhood has done. And just wanted to comment in that regard, and thank you for the letters that you sent, especially Mr. Rodriguez on behalf of your association, Holly, and Mr. Donaldson as well. We had many phone conversations, so thank you. Thank you, Mr. Chair.
Any other comments or questions?
Yes, Mr. Chair?
Yes.
Thank you. I really appreciate how much work has gone into this project and how many people have got themselves engaged on this issue. I'm going to be honest, I chair the Affordable Housing Task Group, and this is an issue that I am very committed to. And yet I understand what the neighborhood is saying when they talk about change and things changing and the uncomfortableness with that. Because in CUPs and by our zoning rules, we could have a much more dense project here. I don't believe that 98 is more than what the site can bear, even though it is uncomfortable right now for the neighborhood. Part of the reasons why I don't think it's too much is the design. I really have always said, I've always questioned height waivers, and when I looked at the height waiver the first time, it looked like it was a height waiver of 4 or 5 feet. It's come down to a couple feet with some assurance that they may not even use that height waiver. On the parking, wait a second, now let me stay with the design for just a moment. The gable roofs and the ability to see through and past the buildings, it's not one large building but multiple buildings, makes the project feel more to scale than what it would be if it was a flat-topped apartment building. Access to Wyuka is still there along our street, and it was very important to me that I continued to see public access through to the park. The historic gates are left, the crossing is left, and so that's very important. I also looked very diligently through the historic preservation comments. My previous career, I did a number of reviews for National Register and National Historic Landmarks, so I am very sensitive to that. And I'm also sensitive to watershed issues, and I did double check with LTU and Watershed to make certain that this project was still going to get a rigorous review and not create downcutting and watershed pressures. Access on parking. A lot of folks have made comments about this neighborhood doesn't deserve to have lesser numbers or lesser ratio on parking, and I want to assure you that a number of multifamily projects have come through in the last 5 years that I've seen either on Planning Commission or here, where we have dropped the parking ratio from 2 to 1.5, 1.4. That is not unusual. And when I dug into what the Hartley neighborhood is right now in terms of car ownership and renters specifically, and I saw that over the last 6 or 7 years, car ownership has actually fallen for renters in the Hartley neighborhood. So that instead of 2% of renters not owning cars, now you have 17% of renters not owning cars. And that's within the 35 to 54-ish age range. So this is interesting to me, and it tells me that people are relying more on transit. And I am very pleased that this was within a couple blocks of 2 transit lines. And then the last thing, people have talked about concentrating poverty, and that they're worried that this project is going to concentrate poverty. And I dug in again on those numbers as well and looked at what the median income is in the Hartley neighborhood existing and what you would need to have to qualify to purchase or to rent these units at 60 and 40%. And it is just about the same. In order to be at 60% AMI, area median income, in Lincoln, you'd need to be at somewhere around $37,000, $38,000. And right now, area median income in the Hartley tract is between about 36 and 42. So it's not concentrating poverty, it's bringing more of the same into the neighborhood. And I recognize that the Hartley neighborhood is more economically diverse than that. There are people certainly at higher earning ends also living in the neighborhood. And for the same reasons that Mr. Donaldson mentioned, I know that we hear from homeowners in neighborhood associations. We don't hear from the renters in neighborhood associations very often, and so I know they're not here. That said, I'm not trying to speak up for them, but I'm trying to recognize that there are many people in all of our neighborhoods that may not necessarily be represented, may not necessarily speak up, but also may not have the same concerns. And for all of those reasons, and because we have a huge shortage in affordable housing units, I am going to vote to support this, and I am going to watch very carefully that everything is done to keep this project within the feel of this neighborhood to the greatest degree possible.
Thank you. Any other comments at this point? Seeing none, let's call the roll on 5C, special use permit, special permit.
Washington,
Yes.
Raybold,
Yes.
Bowers,
Yes.
Schob,
Yes.
Ward,
Yes.
Christensen,
Yes.
McGinnis.
Yes.
Motion carried 7-0.
Okay, let's move on to third reading of ordinances.
Item 6A is Annexation 21001, application of Southwest Folsom Development LLC to annex approximately 41.33 acres of property generally located at the southwest corner of West Old Cheney Road and West Folsom Street, introduced by Washington.
So moved.
Second.
Moved and seconded by Councilperson Ward. Any other comments, questions on this? Okay, let's call the roll.
Schob,
Yes.
Raybold,
Yes.
Christensen,
Yes.
Washington,
Yes.
Ward,
Yes.
Bowers,
Yes.
McGinnis.
Yes.
Motion carried 7-0. Item 6B is the change of zone 21001, application of Southwest Folsom Development LLC for change from AG Agricultural District to R3 Residential District on property generally located at the southwest corner of West Old Cheney Road and West Folsom Street, introduced by Washington.
So moved.
Second.
Been moved and seconded by Councilperson Christensen. Any other comments,
I
questions?
would just want to note, Mr. Chairman, that this is also an affordable housing and workforce housing project.
Yes, it is.
Correct. So just more housing stock is good,
Yes, it is.
is a good thing.
Mm-hmm.
Okay? No other comments? Please call the roll.
Christensen,
Yes.
Bowers,
Yes.
Raybold,
Yes.
Washington,
Yes.
Ward, Schob,
Yes.
McGinnis.
Yes.
Motion carried 7-0. Item 6C is the change of zone 07060C, application of Lincoln Federal Bancorp to revise the site plan for Wilderness Heights Plan Unit Development to allow residential, office, and commercial uses with associated waivers on property generally located at South 40th Street and Yankee Hill Road, introduced by Washington.
So moved.
Second?
Been moved and seconded by Councilperson Raybold. Did you guys see the information we got on this that he sent out, Brad? This is the one you were asking about, that intersection, Jane.
Yep.
Yes, I did see
So,
that part.
yeah, more roundabouts. Okay,
Oh, yeah, I remember now.
okay. No other questions? Please call the roll.
Ward,
Yes.
Christensen,
Yes.
Bowers,
Yes.
Schob,
Yes.
Washington,
Yes.
Raybold.
Yes.
Yes.
Motion carried 7-0.
Okay.
Next, we have resolutions first reading. That's going to be items 7A through 7C. Ordinances, first reading and related resolutions are items 8A through 8F. Pending list, date certain, items 9A through 9C. And pending list are items 10A through 10C.
Mr. Chair,
Yes.
on behalf of the council, I think it's safe to wish everyone in Lincoln a safe and happy St. Patrick's Day. And I move adjournment.
Second.
Been moved and seconded by Councilperson Raybold that we adjourn. Please call the roll.
Washington,
Yes.
Raybold,
Yes.
Bowers,
Yes.
Schob,
Yes.
Ward,
Yes.
Christensen,
Yes.
McGinnis.
Yes.
Motion carried 7-0.
We stand adjourned.